Test one, two. Test one, two. Okay, test, test, test. We're almost ready. We're just trying to set up a few things for those of you online. We just need a few more minutes. Make sure you guys can hear us. If you can get a thumbs up so that Kyle can let me know if you can hear me. Test, 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 1, 2. Probably a little bit louder on this mic. And let me see if I can get this
Test,
right.
test, test.
Sweet.
Mine's louder.
Okay, what? Seriously, we're competing? Okay, if you guys see this flip, remember, let me know. And let's get everybody moving in. So if anybody comes in afterwards, they go to the edge seats and we don't have to get everybody also. The camera can get this angle and instead of getting a whole bunch of empty, well, a couple empty seats right there. So let's go to move in a little tiny bit. And if you guys don't mind. All right, we're going to actually talk about first aid, medical, and health tonight. So it's a big topic, you guys. This isn't for the faint of heart. Okay, so anyways, let me ask before we even get started. How many of you guys are EMT, nurses, medical professionals, and everything else? Tell me what you are.
Former medic, retired.
No kidding.
Yeah.
You're a paramedic.
Paramedic.
No kidding. That's awesome. And you were with the fire department?
Yeah, Los Angeles Fire Department.
Wow. Oh my goodness. That's awesome. I'm a volunteer, a fireman, so EMT and stuff like that. But tell how about you?
Registered nurse.
Registered nurse. Awesome. Okay.
I'm none of that professionally,
That's okay.
but I have done surgery, microsurgery,
Yeah.
and I study nutrition.
Awesome.
Nutrition is valuable to not have the problems that a lot of people have.
Absolutely. Yep. Now, perfect. Okay. Anybody else raise their hands or? Are you serious? Oh, it's so cool. That's awesome. Okay. Now we got a couple nurses here. Anybody else? Awesome. So I'm going to just to give you, in fact, I'll just go ahead and get started if you guys are okay. Are we good on mics and everything good, Kyle, to get going? Awesome. Okay, we are back with Thrivalent step number 5, where we're talking about meeting your other needs, and we're going to be talking about first aid and medical. This is a huge topic. This is something literally we can spend a whole year, 2 years, 5 years trying to learn. I mean, we've got a doctor here, we've got paramedic here, we got nurses, and just to ask you guys straight out, I mean, seriously, have you learned everything? I mean, you can go through the rest of your life. As an EMT, fireman, I feel like every single day I'm learning something new, right? We were poking people with the needles the other day for IVs, and I messed up a couple times, and got a bleeder and everything else. And you just learn, right? You learn by making mistakes and everything else. So tonight, what we're going to be doing is we're going to be covering a lot of stuff, but also very little stuff at the same time. Okay, that's the only way to do it. And so what I'm going to do is I'm going to do exactly what we did before. I'm going to be speaking most of the time, but I'm going to point to a few people to contribute. We got to keep these. I'm going to just start over, you guys, because I didn't tell you guys that ahead of time. I'm going to have you guys do the same things as yesterday. I don't want you monopolizing any of the conversations because we got to keep it moving because we have a whole bunch of videos in this series. The people online, you're not going to be able to see the slides because I'm going to be editing those in later on. Okay, so just to let you know, if anybody comes on later and says, I can't see the slides, just let them know it's because you're not supposed to. When you get to the Thrivalist course, you're going to be able to see everything, but they've got to get me filmed so I can put in the slides where I need to later on. So just to let you know, that's what we're going to do. Also, if you guys don't mind, when there's questions and everything, just respond and be part of it. Come up with ideas and everything else you want to share, but don't share too much, right? Kind of in the middle somewhere, right? Okay, so let's just have fun with it and everything else. Did I miss anything from yesterday? Can I get a little bit of energy? Woo! Okay, let's do this. Cell phones. Turn off your cell phones. Okay, make sure it's quiet. It's in the middle right now. I started early this morning working on PowerPoints and I didn't finish quite, so I'm going to wing a little bit, but well, that's good. It's going to work out. So we'll do what we can, but I had work to do, help out the warehouse and everything else, so did what I could. And somehow it keeps working out. I mean, I don't know how and why, but I'm feeling more energy than yesterday, so that's what's good. Yesterday, I was like, I pushed it too hard. Before I even started, I pushed it too hard and I knew it. I was feeling super weak. And then we got those blueberries that came in and during the break, and that gave me just, whew, I could just think after that. And so that was really awesome, bringing those. And this is what I'm going to do before we get started. Okay. Are you serious? I was at the very end.
Like
I was at the very end. And I was like, man, my wife would be so proud of me. I'm such a show off and everything like that.
looks like you have a drinking problem.
Definitely have a drinking problem. Seriously, I have been a show off since I was a little kid, and I don't know how to do it any other way. And I was sitting there as I was drinking, I'm like, okay, I can drink a little bit, but I'm gonna keep going and see how far I can go on this. And then I thought of my wife, and I thought of her literally saying something like, Marcelo, cut it out. Marcelo, stop it. Marcelo, you're showing off again. I'm like, oh man, but it's too fun to do it. Okay, so let's do this. Let me see what the second slide is, and then we'll go from here. Okay, perfect.
Well, that's preparedness. If they're shooting bullets at you, but you need to drink, you could drink and get it over with.
There you are, and then let them shoot you, or
No, you could drink fast and then go back to.
and then get back to whatever, right? Yeah, awesome. Okay, Thrival is step number 5, and we're talking about first aid and medical in this video. Super excited. This is a huge, gigantic topic. I mean, you can spend your whole life. We got nurses, doctors, we got paramedics in this room, and literally EMT, firemen, former firemen right there. And literally, we can spend our whole lives trying to learn this stuff, and we'll never learn it. Okay, all the different things you can master and everything else. You know, we were doing IVs the other day at the fire station, and I was trying to do it right and everything, but I got a bleeder. You know, and if you've seen those before, those are kind of fun to clean up afterwards, right? And you just got to learn. You just got to do what you can do. Well, today in this meeting, in this class, we're actually going to go just a little bit into medical because we can't cover everything. So I'm going to cover a number of different types of categories, and I'll probably pick 2, 3, 4 things in each one. Some of you might have you just say, hey, what about this? And we'll go a little bit deeper. But we want to keep it simple enough that the people watching this video, all of you wonderful people watching the video, aren't intimidated, but at the same time deep enough that you're intrigued. Now, a lot of people say, well, what type of things should I get for first aid? And I say, well, what do you know how to use? Right? You get a whole bunch of stuff. You know, you go and get yourself an OPA, for example, and you're like, what's an OPA? You know, how do you do this? What do you put in your ear? What do you do with it? Right? You know, it's in your mouth, not in your ear, by the way, or an MPA where you actually put it in your nose. But a lot of you don't even know how to use these. So maybe you don't get it, or you'll learn how to use it. Does that make sense? So don't overwhelm yourself with a ton of stuff. Something is better than nothing. If you get something for your kid, it's better than nothing. So we're going to go through a few things. You're going to look at the category. You've got your workbook in front of you. You can look at all the different suggestions I gave you, and you can put little check marks by anything and everything that you want to get for your kids. So with my kids, for example, I have a big kit I keep at home, but I also have extra supplies in closets in case I ever need it. Now, part of the reason I have that big kit is because I want to be part of the solution. If anything bad happens, I need to go out there and triage and whatever else. I want to be able to have everything I need to be able to be part of the solution. That's why I got a kit. A lot of you will never need that. You're just going to put it in a little medicine cabinet, or you put it underneath, you know, the sink or something like that. Anywhere you can get to it, right? But you do it the way you want to. Do it the way that's going to serve you. Do it the way that's going to serve your family, your friends, whatever you want to do. You know what you need. So use the workbook, use the course, use this video to do everything you need to with first aid and medical as we go through this today. So with that in mind, during an emergency, you never know what's going to happen. Okay, if things get bad enough, okay, the hospitals are going to shut down. Okay, as a fireman, right? What do they tell us? It's not your emergency, right? Yeah. Okay, if things get bad enough, guess what? The firemen stay home. Yeah, the police stay home. You know, you do not have help. So if that's the case, let me ask you this question. Okay, and I don't know if we have the mic around here. We have the mic somewhere? Perfect. How would you cover your long-term medical needs, your first aid and medical needs, if everybody else shut down, all the hospitals and everything? And I want to hear some of your ideas before we get into this presentation today. Let's go right here.
Regarding tourniquets.
Let's use the microphone, and then just...
Regarding tourniquets.
Hold on, I think we're off on the mic. Oh, right. Yeah, it's on.
Regarding tourniquets, everything I've seen on training is telling you what to do for first aid so that you could get them to the hospital so they could stop
If they're bleeding, right?
repair the severed artery and
Yeah, or
save the
something like that,
limb.
right?
But in desolate location where
Mhm.
you don't have that, where there aren't doctors, where conditions that you described, a tourniquet means that if you don't get them to that help in 20 minutes or to an hour, they're going to lose that limb.
Could be.
So,
Yeah.
uh, here's what I want to say about that.
Okay.
I have sutures that are for arterial repair,
That's
including
awesome.
small arteries, and I've done it before.
That's awesome. Thank you for bringing that up. What else? Let's go ahead and go back here. Can I give this to you? Thanks.
I need to get educated.
Totally.
I don't want to hurt somebody or do more harm than good.
Yeah. And the thing is, doing something's better than nothing, right? You're if you stop yourself because you're too afraid to do something, they're gonna die, right? So, or possibly die, right? So you just got to do it. I mean, even heart attacks, right? We get in there and we watch people die, and you've been in this situation where you're pumping, okay? You're pumping the heart, okay? If there's no electricity going through those nodes, if they're dead, they're dead. Unless you can get them to a hospital or some type of AED or something like that, they're dead. So why even keep pumping? If you can't get to help, why keep pumping? Why would you do that?
It's the right thing to do.
Liability.
Liability, but say world's falling apart.
Keep oxygen going.
Okay? Part of it is because you did everything you could, right? That person dies, you don't even try. How are you going to feel afterwards? You do everything you could and they died. How are you going to feel afterwards? Does that make sense? So do something, right? Even if you don't know what you're doing, try to do something. Because in the end, you need that as much as they do. Does that make sense? Okay, what else? Let's get some other comments. Let's get microphone on these two right here.
I think it depends on what type of an emergency you're in. If it's at home and there's a disaster, it would be good if you were familiarized, like you've done here,
Yep.
finding out who in your neighborhood has some medical expertise or experience.
That is so awesome.
It's the same if you're at an accident scene, which has happened, I think, to probably all of us. You want to, if I'm a first responder and I'm in charge, but if the next person is a doctor,
Yep.
then you want to turn the lead over to them.
They know what they're doing. Let them lead.
So let them take
Right.
the lead.
Let them take over. You hit something amazing because later in the course, when we get to community and helping others get prepared, that's a big part of it, right? Like who in your community is a doctor? Who in your community is OBGYN? Who in your community is a surgeon? Who in your community is a dentist, right? Who can you lean on and how can you bring them as part of your tribe, right? Part of your people, right? So that was awesome. I thought I saw one more hand or one or two. Go ahead.
So I like also how you said long-term first aid.
Mm-hmm.
When you can just go to a hospital or you know that you can hand it off to someone, you think differently than when you realize that there's not a hospital for you. So
Yeah.
first aid obviously is, I mean, the first response is still the first response, but thinking long-term first aid sounds like a really big part of that equation.
Absolutely. So one of the reasons I did, in fact, I'll back up a little bit. Back when, if you were to go back about probably close to 10 years ago, I was interested, you do your BLS, you do your basic life support, your CPR training, all that stuff, right? And I was talking to someone and I said, I want to learn more about first aid. What would you recommend? And he says, take an EMT class. Well, I'm not planning on being an EMT. They don't worry about that. Just go take an EMT class. And I was like, good point, And some of you can't afford $1,000 for an EMT class or whatever it is, right? So you can become a volunteer fireman, they'll pay for it. Or you can just go online. If you go to YouTube, you can actually find all the EMT classes on YouTube and just go through and learn them. You might not catch it all. You might forget most of it, okay? But that's okay. You'll learn something. And the more you learn, it builds on each other. Somebody told me a long time ago, when you're learning something, it's kind of like a stool. You got a stool right here and you got a bag of sand, okay? The stool's about that big and it's about this tall, okay? And you take a bag of sand and pour it. How much of that sand sticks? Nothing, barely, right? A little bit, tiny bit, and it shakes off after a little bit with a tiny bit of wind. Okay, so you take that a bag of sand and do it again. Barely sticks. Okay, do it again, do it again, do it again. After a while, that bag of sand, the sand gets to about this point. Then every single time you pour on it, it just builds on top of it, right? It just keeps going. That's how knowledge is. I mean, you expose yourself to enough first aid. After a while, it starts making sense, and then you can use that to connect other things you don't know. And it just goes faster and faster, but you have to have enough of a base. So expose yourself to terminology, expose yourself to different ideas and everything else. Go to some classes, EMT training and everything else. Now, the reason I became a fireman, okay, is because I didn't want to wait until an emergency to learn how to handle an emergency. And I messed up a bunch of times. There was times I went out there, I remember one time I froze because of my ADD. Like I didn't know what to do. I just froze because of my ADD. And I didn't expect that. But guess what? Now I learned that I can freeze because of my ADD. So I have to sit there and stop, take a breath, assess the situation. This sounds crazy, but that 5 to 10 seconds feels like 5 minutes when everybody else is just moving and you're standing there trying to figure out what to do. You look around, see the problem, create a solution in your mind, move, right? But sometimes you need to do things, but you wouldn't know that unless you put yourself in the situation. So that's why I became a fireman, you know, to be able to figure out how to handle the emotions, how to handle watching someone die, how to handle watching somebody cry because somebody died, okay? How to handle what it feels like afterwards when I just watched something traumatic and now I got to get over it, you know? How do you not lose the feeling? How do you not lose the compassion for people, right? And then you have gallows humor and everything else everybody goes through because they just want to get it out of their brains, right? So just expose yourself to a bunch of things because in reality, if things get bad enough, you're on your own. You and the people you know, if things get bad enough, okay? So let's talk about some of the things we're going to cover in first aid, and I'll just read through these 10 categories. Personal protective equipment, PPE, breathing and airway management, blood circulation and heart issues, wounds, bleeding and physical trauma, thermal radiation and chemical burns, hypothermia and hyperthermia, broken bones, sprains and strains, trauma, infections, fevers and sickness, and other items to consider, and recommended training and education. I'm just going to give you a huge list in the end. So we're going to cover all these, and that's a lot to cover, but this right here is probably a good 90% of what you would need to know. Actually, probably 95 or more, right? Probably almost 100% of what you would need to know in an emergency situation. So let's go for the first one. PPE is something they put in our brains all the time, that when you're coming to a scene, you always have to protect yourself and protect others. So PPE, okay? If I were coming to a scene, obviously I would have on gloves, okay? And you get yourself some gloves, right? And I'm just going to show you this real quick. When you put on your brand new gloves, hope I got the right size. Hope I didn't get my wife's. That's a little tight. Okay? When you put on these gloves right here, and you get them contaminated with who knows what, and you don't want to pass on any diseases or blood or whatever to you and your family, I'm just going to show you this real quick so you guys can see the proper way to take these off. Okay? It's really easy. Okay? You got two gloves right here, and people say, well, just take it off. Right? Okay? So what you're going to do is really easy. You got your gloves on. You're going to grab the middle of one of them. Okay? Pull it off, and you never touch anything. With the other hand, you take a finger, pull it underneath, and put the other one inside of it. And now you got it inside out, and you throw it away. Got that? So it's super easy with PPE. Some of the things you should have in your emergency kit, in your first aid kit, is if you can get an N95 mask, and there's a whole bunch of different types. This is just a foldable one right here. N95 mask to put over you so that you're not breathing in stuff that you shouldn't be breathing in. You should have something like that. You can have some type of alcohol hand sanitizer. If you want to go one step further, you can have some protective glasses in case any blood splatters or whatever. But this is stuff that's not typically in a PPE kit, but I'm going to add it to it. Some type of light, especially a hand-free light if you can, okay, so you can see things. And nobody ever does this. Why would you need this? Call for help. You got it. Okay? Or sometimes you're in danger. Sometimes you show up and other people are attacking somebody, but then you get attacked or whatever, right? But you can use this to scare people, call for help. You can even put a weapon in your PPE if you want to. But this right here is something I would add to everybody's PPE, even though nobody does it. Does that make sense? Okay. Let's get to the next one. And now I think we're talking about breathing and airway management. This one's a huge, gigantic one. Because obviously if people can't breathe, they tend to die. I don't know why. You know, it just happens. So you go 3 minutes without breath or air. You go 3 minutes without blood, you can die. So those are really important to make sure that people have open airways and they're not bleeding to death. So with that, I'm going to just show a couple things. Now, remember, this is first aid and intermediate first aid, not even super advanced. Part of first aid is that you can have Band-Aids and you can put them on boo-boos. Okay? Part of first aid is I can't breathe very well, so I get some salt water and use a neti pot. Okay? Which could go under sicknesses and infections as well. But this can go under breathing. Does that make sense? So that you can breathe better. Part of that could be an OPA or NPA that we talked about. This is actually good to learn how to do because you can stick it in the mouth. You can actually get it in the throat and open up a throat so people can breathe. There's some people that get out there and they purchase these little sucker things. Now, whether it works or not, I've never been able to test it. Some people swear by it and they say they absolutely work, right? Where you put this on and go and take something out of somebody's throat. Okay. Does it work? I have no clue. It's an idea. If any of you just figure that out, let me know. Okay. They work. So you've actually had it. Personally, you saw that? On who? Do you have the microphone? No, it was on.
It was on a child at a family event. My wife's an EMT.
Yeah.
And we have those in all of our vehicles, in our home, and all of our kids' homes.
No kidding.
Mounted on the wall, and they work amazingly
So can I ask you a couple questions if you don't mind? So did they, how small of a child? Baby?
Probably about 6.
6 years old. Okay,
Yeah.
so they're about
Yeah.
that tall.
Yeah, not a
And
baby.
so did they hit the back? Did they, anything, did they go straight to this?
Straight to that.
Was the child breathing at all or completely
No,
clogged?
nothing.
And it worked?
It pulled
Wow,
it right
there's
out.
a testimonial. Yeah. Thank you for letting me know. That's something I just didn't know, but I figured why not get it, you know? I don't know what they're called exactly, but life vac. Yep. So also you can do medication, albuterol, other things that might help out with different types of breathing problems. Epinephrine, if you guys have the EpiPens, they actually sell an epinephrine inhaler now. And my daughter has breathing issues sometimes. She has allergic reactions. And so I actually tried out the epinephrine inhaler. It actually worked. You know, it doesn't last forever, but it got her some instant relief. And I thought that was pretty cool, right? Okay, you were going to say something?
Yeah, I had
Make sure you get the microphone.
I had a epinephrine incident.
Yeah,
I had gone and had a spinal injection,
Yep.
and they gave me a trace agent. And we got home, walking up the steps to the back of the house. I couldn't breathe.
yeah.
I could not get air. And fortunately,
You had an EpiPen on you, or did you?
no.
No, wow.
No. So my wife threw me in the car and took me to minor emergency.
Yeah,
And before I could even get in a room, epinephrine.
yep, exactly. Open up the airways, right?
Yeah,
Very
but
quickly.
that's scary.
Oh, yeah. Yeah, can't breathe, right? You don't forget that. Thank you for sharing. Okay, let's see if there's anything else. Oh, here, I'll bring this up. Okay, so you have a pulse oximeter. This is something that everybody ought to have as well. I have a number of them at home, but I brought one to show you that there's different sizes. Sometimes little children with the regular adult one, it doesn't work very well. So I bought a little tiny child one for my kids. And with this right here, it's really awesome because you can just press it. You can stick your finger in there and it can tell you your heartbeat. So you can see if it's way out of whack. You can see if somebody's like beating 60 or 50 or 40 beats per minute as a 6-year-old, which is totally off, right? Okay, or 180 as an adult or something, you're like totally off. But also it can tell your oxygen. So if they're having a hard time breathing because of some reason, you can take a look at this and go, oh my goodness, you're in your 80s. Okay, you're not 95, you're not 96, 97, or anything else. You're in a bad situation right now. Okay, and this can give you a quick little diagnosis on what's happening. Okay, another thing you can do is if you need to listen to the breathing and you're good at this stuff, you can, actually not have to pretend to be doctor. You can actually listen to people's breathing, see if there's any crazy things happening in there. For those of you who want to get more in depth, there's a whole bunch of different types of breathing sounds to figure out what it could be. Okay, stridor, it could be crackles, it could be all these different things in your lungs, and then you can diagnose exactly what the problem probably is. Okay, they're having anaphylactic shock. They've got some type of allergy or something like that. They can figure it out a lot of times from the sounds itself. Okay, so let's get to another one. Any of the doctors, EMTs want to learn, add to the breathing before I go to it? Let's get a microphone on you. And I don't know what I do with my clicker. That's so funny. I always lose it. Right in front of me. Now this is a TV. Did I put it down somewhere? Did somebody take it? I had my clicker, and I bet it's probably right here. There it is. Okay, go ahead.
One thing to keep in mind with the nebulizers,
Yep,
if they're not able to take a breath, like in that situation, it's not going to go
not
in.
going to do anything.
So have the EpiPen and the nebulizer both.
Yeah,
Because they're in the hospitals or in the clinics or whatever, they're going to give you Epi probably either IV or in the muscle, so they can open it up before they give you the nebulizer. Because
Yep.
if you're not exchanging, you're not going to get
it's
the
not going to
medicine.
do anything. You're actually right. Yeah, and so that's a really good point. Thank you for bringing that up. So awesome. Let's get to the next one. Blood circulation and heart issues. Again, pulse oximeter is a really good thing just to see what's happening with the beating heart. Let's see if I want to bring up a few things here. Any of you that do have heart issues, I would recommend getting some baby aspirin, and your doctor will tell you about this. Baby aspirin, nitroglycerin, and having those on hand in case you need it. But also, I'm going to share something with you. A lot of people can die of a heart attack, okay, have their heart stop simply because they don't have electrolytes, because they ran out of electrolytes. Your little AV node, your little heart, all that stuff needs to be fired. It needs the potassium, it needs the sodium, it needs all these different things. So there's people who are drinking water without any electrolytes. And it's actually doing them some harm rather than the good they need. In a really bad situation where you're not feeding yourself well, you're not drinking, you're in a hot situation, whatever it is, just remember to get the right nutrients in you as well, because it can affect your heart as well if things get bad enough. Does that make sense? Okay. So anyways, aspirin, nitroglycerin, you can get some heart monitoring equipment. You have electric heart monitors for blood pressure, right? To find out where your blood pressure is. You have mechanical ones as well if you want to use those. And you can learn how to use those as well. See if anything else I want to cover on heart. Again, AEDs, if you do have heart issues at home, it's a good idea to have a good AED, okay? You want to explain one real quick, what AED is? Come on up here, I'll let you take over a bit.
AEDs are basically to take any kind of activity with the heart and reorganize it. So if the heart's not beating at all and they're flatline, this basically doesn't do anything. So it doesn't restart the heart, it just reorganizes the heartbeat itself. So basically, if someone looks like they're having a heart attack, you hook them up to it either way, because you're not going to know whether they have the heart rate or not.
If they
Hook
have
it up
any
to
electricity in there.
any electricity whatsoever. And usually when it will look the same as with no activity as when the heart is actually quivering. That's electrical activity. And so what this thing does, it kind of gives it an electrical slap to the face or a slap to the heart, and then it kind of reorganizes it.
Yep. And one of the cool things about these AEDs is that it actually has instructions in there. It doesn't really take much. I mean, you put it in the right places. It shows you. You press the button green, and it says exactly what you need to do. You know, it talks to you and tells you exactly what to do. It tells you when to shock them. It tells you everything. Okay, and so you really don't have to be super nervous. You just grab one and then use it and just follow the instructions.
Practice it though.
Yeah, practice it a couple times. Absolutely, awesome. Thank you for. They get pricey. I mean, there's you get a good one. It's probably what $1,000-$2,000 or so. So they could get pretty pricey. And then they make you replace parts every couple of years, and it doesn't work until you do. So they can make a lot more money, right? But if you do have heart issues, I mean, what's $1,000 for life, right? And so what's $2,000 for life, right? Okay. All right. Let's. Anything else anybody wants to add on this portion right here, where blood circulation, heart issues? Okay. Awesome. Let's get to the next one. Okay. These are wounds, bleeding, and physical trauma. This is the one you're probably going to want to focus on the most. Bleeding out, right? Because that's probably going to happen the most if you get into some type of natural disaster, some type of catastrophe, guns. I mean, people, lawlessness, and everything else. So you need to know how to handle this. With all my kids, okay? It doesn't matter if it's this big red one right here. It doesn't matter if it's my car. It doesn't matter if it's my getaway trailer, okay? With all my kits, I always create what's called a trauma kit within my trauma kits, okay? Because when you're in a situation where you just have to grab things very quickly, or you have to run somewhere or whatever, grabbing that big thing right there and fumbling through it when you're nervous and there's a whole bunch of commotion and everything else, and having to grab it and go 500 feet and carry it and everything else is just horrendous. So you open up your kit, you grab your trauma kit, and all of a sudden you can go help somebody a lot quicker. Because sometimes you only have literally a minute, 2 minutes, 3 minutes to help somebody. Does that make sense?
Is that something that comes prepackaged, I'm assuming?
We do have some of them here. I add stuff to it.
Okay.
Okay, so we do have some. But I can show you some of them, some of the stuff in it. Do you guys want to see some of the stuff? Okay, let me just see if there's anything I want to cover here. Okay, so obviously you have first aid or just bandages, regular bandages. Okay, you can get tape, you can get anything you want to like that. You got self-adhesing tape right here that you can wrap around somebody if you put some type of bandage on it. And these are really cool too. See if I can see without my glasses. Because look at this right here. Let's grab a bunch. Where's the microphone? How sticky is this? Go ahead and touch it.
Not at all.
Not at all, right? Isn't this interesting? This stuff is awesome because it's flexible, and I'm going to put this around your arm, okay? And I'll put it around 2 fingers because we don't have too much right here. But look at this. It sticks. Isn't that cool? Bring it up for the little camera there. It just sticks. And it's the cool thing is there's no adhesive here, but you wrap it around and it just stays.
You can reuse it.
Yeah, let's go right there.
And if you twist it right at the point of where it needs, that's where you can place pressure as well.
Totally, exactly. Help with those. In fact, I'll talk a little bit about that. I think I'll go a little deeper into a few things here. First of all, okay, you need some shears. Okay, I got some shears. I've got a bunch of different types of shears. The reason I like these is because it has a ring cutter. And so I can, if I needed to do a ring cutting, I could, but you don't need it, okay? If anything's swelling, I can literally go up to my ring and go and take it off, okay? So these are just an example of some, but these are really pricey as well. You don't need to go all out. You can just get yourself a cheap pair because something's better than nothing. If you cannot do that, can't afford it, literally just get a cheap pocket knife or something. And I just have a multi-tool inside my first aid kit anyways, because why not? You never know when you're going to need something, and you don't know what the situation's going to be like. So might as well have a multi-tool. Why not? Right? You have inside this trauma kit, I'll go through a few things in here. Let me open this up. This is my fallout because it has a lot of stuff in it. Okay. Yeah, it's going to probably fall. I've got my PPE, obviously. I've got electrolytes in little packs. Okay. I've got sugar packs for anybody who has diabetes, where I can take care of them very quickly with some type of sugar. I've got myself some um, Narcan, okay, which you can get for free. Okay, anybody who's dealing with drugs and they're passed out, you never know if it's because of drugs or not. If they're passed out, it's not going to hurt to use Narcan. Okay, if you think possibly there was some type of drugs used, just you put it in the nose, it can wake them back up, and you can get these free at a lot of community centers. A lot of, where would they give them now? I know libraries, they were giving them. Libraries and other places, they give Narcan for people who abuse drugs. Newstat. Okay, a lot of people use Quick Clot for stopping blood. So if you have an arterial bleed, right, you're going to obviously stuff the wound and everything else. But with this right here, this is it's a why I just went blank. Hemostatic. It's a hemostatic dressing. Okay, so hemostatic dressing. What that means is you put some kaolin. This is a Quick Clot uses kaolin, if I remember right. Are they using kaolin? Okay, so you have kaolin. This is a powder. I just have a ton of it because why not? Okay, but things like yarrow, powdered yarrow, cayenne pepper, kaolin, all that stuff coagulates blood. The difference is when you're using the Quick Clot versus a Newstat, which does the same thing. This is made out of, I think, shrimp shells. Can't even say that. Shrimp shells. Okay, but the interesting is this right here actually keeps the pooling from happening, where the other stuff allows for pooling. So I kind of lean towards the Newstat instead. Okay, but what this is for is if you have an arterial bleed, you can't stop it with pressure, and you need to stuff it or you need to put stuff in it. It'll actually help stop that arterial bleed. Does that make sense? Okay. Any thoughts on that? Okay. So I'll go a little bit deeper here. Let's see what else is in here. Okay, I've got burn stuff. A lot of people do not put burn stuff inside their trauma kit, their stop the bleed kit. I've got burn stuff that works really well. My favorite burn stuff is in here, but I'm just going to show you because it's right here as well. It's the armor gel. I used it on my wife the other day. She was putting all this different stuff on, and I said, just put the armor gel on. Took away the pain. By the morning, she was like, wow, it's amazing. It's healed. Okay, amazing stuff right here. Okay, so I put this in there for burns. Obviously tourniquets, but with my kit here, I actually have 2 tourniquets, not just one. Usually people only have 1 tourniquet. I don't know if you've ever come up to a scene where you have 1 tourniquet and all of a sudden it's not working. You don't take it off. Okay, you put on a second tourniquet. You just go further down. So you just go high and tight, right? And then if you need to, you go 1 down. So we went to a guy who had lost his whole leg. Okay, he was bleeding to death. He died. Okay, and he had it. We put a tourniquet up here. Didn't stop the bleeding. Somebody didn't do tight enough or whatever. So we had to put a second one on. I carry 2. You don't have to carry 2. You can if you want to. In fact, while we're talking about tourniquets, let me just pull one out. When you're looking at tourniquets, you always want to make it super easy to be able to use tourniquets. And I'm just going to show you this real quick. I didn't pack this one. Somebody else did because I wouldn't have done that. Let me grab this one right here. Do you see this? Okay. Watch this when I pull it out. Okay. Because I think I'm sure I packed this one. See how big that is? Okay. A lot of people will fumble with it afterwards. But what you want to do when you're packing your tourniquets is you don't want to go down like this, like a lot of people do. You want to go as big as you can, okay? Close it off and then fold it up so that in an emergency situation, you don't have to adjust it. You pull it open, it can fit around the leg and arm, anything like that. Just don't put it around your neck. It doesn't work, okay? And then you can actually grab this real quick and you can pull it in, close it off. And then what you're going to do is you're going to take this right here and you're going to start tightening it until that blood stops. Okay? Once you're done tightening it, you're going to take yourself, let me see if I have one, should be here. Anyways, usually I have my marker. I pulled a marker out, don't know what I did with it. But usually you'll grab a marker, a permanent marker, which I do have in my little kit right there. And you'll put the time right here of when you put this on, or put it on their forehead if you need to. And you can't put it here, put it on their forehead. Somewhere where somebody can find out what time you put the tourniquet on. Does that make sense? Okay, so let me see a couple more things I'd like to share with you guys here. Obviously there's wound flush. There's just a bunch of stuff in here. I'm not going to go through every single part of this because I'll have to put it all back together later and I don't want to. But one of the things I do have in there is Israeli bandages. These are awesome. Okay, it's a bandage and a pressure at the same time. You can wrap it yourself if you needed to in a bad time. But you can take this, wrap it. It creates pressure right where the wound is, and it helps stop the bleeding pretty quickly, especially if it's not arterial. Does that make sense? Works really well. This is Israeli bandage. And let's see if I want to grab one or two more things. Oh, this is another one I always love to have. Okay, not to give shots. What's it for?
Wound flush.
Yeah, to clean wounds. A lot of people think that you're going to put alcohol on wounds and clean the wound. That actually ruins the wound. It actually breaks down the cells. It doesn't allow the skin to fix itself as quickly. So what you want to do is you want to use just really clean water, and if you need to, just clean it out where you can. It might hurt a bit while you're doing it, but you're cleaning it out. If you have to, then you can use some soap and water if you need to get rid of some oil or whatever you need to get rid of. You can use soap and water, but try to stay away from the traditional alcohol on a wound like everybody thinks you should do. Let's get a microphone up here.
Oh, I was just going to say, don't use hydrogen peroxide.
Oh yeah, exactly. From a nurse, don't use hydrogen peroxide. You're exactly right. Let's go 2 comments right here.
We are into preparedness, and you might not have a wound flush, or you might run out. So here's how to make it. When you do your pressure canning, get a clean canning jar, put in purified water and 0.9% of a pure salt, and pressure can it, and then it's sterile
Great
forever.
idea.
And then get a hand sprayer, an industrial one, and don't put anything in it. Just have an empty one. You put the water in it. You could adjust it to a needle-like prickly
Sure.
spray, and you could spray out
Absolutely.
contaminants out of the wound.
That's a great idea. Awesome. Pass it right behind you.
In a pinch, you can use that neti pot.
Oh
salts.
yeah, totally. Yeah, that's a great idea. I mean, you can grab anything that squirts water. Just don't do it out of your mouth, right? In fact, one thing that's interesting is in one of the earlier classes, I taught about hypochlorous acid. It's one of my favorite things in the world. Okay, it's about 120 times more effective than bleach. It doesn't bleach the floor like my child peed on the floor of the carpet and stuff like that. We just soaked it really well. It killed every bit of bacteria in that, and we just soaked it right up. But it's hypochlorous acid. We talked about it earlier in the course. I'm actually going to talk about it probably in a few lessons from here. I'll go more in depth into hypochlorous acid. But this right here is what your body creates naturally. It's made out of salt. It's made out of, you can make it out of salt, out of white vinegar and water. And you use a electrochemical reaction to be able to create it. The cool thing about this, again, 120 times better than chlorine or bleach to be able to kill things, but you can use it on wounds. It actually works. You get a pink eye, you can put it in your eye. The other day, I actually had a sinus infection up my nose, right in my mouth. Okay? Yeah, I put it in a neti pot. And then I just put it in there. Just put a little bit in there, diluted it down, and I probably shouldn't be doing this for to get in trouble with anybody who might want to sue me. But I am not a doctor. I'm not telling you to do this, okay, or anything like that, because people are crazy these days. But the thing is, I mean, smell this. Can I put it on somebody's hands? Totally healthy.
It's only for bears.
Right there. Take a look at that. Yeah, exactly. Do you guys smell that? Yeah, it smells like pool. Okay, this stuff is amazing. I put it on a rash on my hand, and I talked about this before. Put it on a rash on my hand that I could not get rid of, and I put it on there, and it healed up super fast. So you can use something like this. And again, I love these right here. If you need to, and you're trying to cut down on the infection, again, do not use hydrogen peroxide. Do not use alcohol. Use this. Use something that's safer, that's not going to kill the cells while you're trying to heal someone. Okay? Yep.
Do you make your own?
Hypochlorous acid?
Yeah, thank you.
Yep. Every couple weeks, we make it at home. Yeah, I can show you sometime. So it's pretty easy. So you can, it takes about 9 to 12 minutes to make a batch. Super easy. Okay. Let's see if I want to cover anything else. Chest seals is probably another good thing you ought to put in your what's called trauma kit. Thank you. In your trauma kit. I have these in my trauma kits as well. Say again.
Is that for the sucking wound?
Yep. Yeah. So you got yourself a chest trauma kit as well. Let's see if there's anything else I want to cover here. Some people, wound seal is good to stop little wounds from bleeding. Some people use super glue. I mean, you can use a whole bunch of different things. You got to be creative. Oh, here's another one. I'll bring this one up. This is one of my favorite things. This is called Techoderm. A lot of people don't know about it. But Techoderm, I've tested it out for about 2 weeks on myself. This is a bandage. So a lot of times when we're doing an IV, okay, we'll actually put Techoderm on top of it. When people are doing operations, they'll put Techoderm on top of it. This is a completely breathable and completely waterproof bandage. Okay, that's why I said I tested it out for about 2 weeks. I'm taking showers, bathing, washing my hands, everything. It stayed on, and I'm like, wow, it's not turning white underneath like, regular when water gets underneath and everything. Your skin starts rotting, right? And it just worked perfectly fine. So Techoderm is another thing. And I have a lot of these. I mean, you can go through the whole list and you can see a whole bunch of other stuff that I recommend. Go ahead. Yes. Okay.
Something that I learned about this year is I have a granddaughter that gets very severe nosebleeds. She's
Yeah.
had her nose cauterized in that. And there's such a thing called a nampon.
What is it?
It's nampon.
Nampon. I've never heard of that.
You put it up the nose. It stops
Oh,
the
and it
bleeding.
cauterizes it.
It doesn't cauterize it, but it stops the bleeding.
No kidding.
Whatever it does, it stops the bleeding. And I
Really?
have used it, and it does work.
Really? No kidding.
Yeah,
That's
nampons.
awesome. That's
That
good
would
to
be
hear.
something that would be good to have here.
Yeah, let's get another one. In fact, a little story here. When I was in California in high school, I would get bloody noses all the time. I don't know why, I just did. And it was the coolest thing in the world because if it was really boring in class, I literally could do this, and then it'd start bleeding, and I'd sit there and just let it bleed a little bit, and I'd go, teacher, I gotta go. And teacher would go, 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 go. And I was able to get out of so many classes. It was the best thing in the world. So I'm glad, today I would probably use that. Back then, oh man, forget it. That is like, go ahead.
There's an item called green stick. Some of you guys that still shave with a blade razor.
Yeah,
And it seals it right off.
yeah,
And it's great. They come in a book. It looks like a book of matches.
yeah.
And you can run that up in your nose and it stops it just
That's
like
awesome.
that.
But you'd probably use it on your skin too, the stuff
Yep.
you're talking about. So cool. What'd you say?
It burns.
It burns pretty bad?
It burns, yeah.
Oh, wow. Okay, that's good to know.
It burns. It works.
Well, good. So anything else we want to cover here with wounds bleeding? This is a big topic. This is probably the biggest one right here. Anything else you guys would want me to cover? Let's look through it. Surgical tape is good to have. Pupil light. If you're looking at a pupil light, a lot of people don't know why to even use this thing right here. Okay, the pupil light isn't for let's check out your tonsils and everything like that. A lot of times it's just to see if you're dilating or not, or if they're unequal. Okay, if they're not unequal, it's most likely because you got some type of head trauma, and you don't want to deal with head trauma if you don't have to, right? So look for unequal eyes, or it could be some type of drug, something, who knows what, right? Go ahead. Oh, let's get the microphone.
I have a comment on bleeding. Make an appraisal, especially if it's you and you know your history. If you're bleeding a little and you know that your body is going to clot and stop the bleeding quickly,
Yep.
don't try to stop it. The bleeding flushes out the germs and the bacteria and the contaminants.
Yep, to a certain degree, right? Yeah, it's like you want the body to do part of its job, but you don't want to bleed out too much, right? And so that for some reason could hurt you. It's kind of weird. Let's see if there's anything else. Anything else you guys want to cover here? If not, we'll go to the next step.
Is that for disinfection?
Some people use it. Again, I'm not a huge fan of it, but some people use it just for disinfection and everything else. So I put it out there as an option. Yeah. Okay. So anything else? Let's see if I want to cover. I think I got pretty much most of the stuff I'd wanted. Tweezers. Definitely get tweezers. Gauze rolls. Yes, definitely you have a lot of gauze. Okay. You underestimate how important gauze is. I probably have a bunch here that I put down. I don't know if we put it out here or not. But gauze, you can stuff wounds with it. You can patch wounds with it. You can do a whole bunch of things with gauze. So just have a whole bunch of different sizes, rolls, flat ones, everything else. Okay. Anything you would add? No? Okay. Awesome. Okay, let's go to the next one. And we're going to go through thermal radiation and chemical burns. Now, this is important in the sense that if somebody has a burn covering 10% of their body or more, it's dangerous. If it's 30 to 40% or more, it's lethal. Okay? So when you think about it, somebody falls in a fire and burns this part of their body right here, that's a lot. And you got to figure out what to do very quickly, right? To be able to help them not die quickly, get them to some type of help. There's rules of 9 if you've ever heard of that. If you ever want to understand how much of their body actually got burned, you can do the rules of 9. So you have 9% is an arm, 9% is an arm, right? 18% is the front, 18% is the back. I'm going blank. 9 on the head, right? So I think it's 9 on the head. And then we have 18. So 9 and 9, 9 and 9. And then the private parts is 1. Okay, so, but you have the rules of 9. So you're able to take a look and the whole arm is burnt. You know right there, that's 9% of the body. Okay, and obviously a child's going to be different because they have bigger heads. Okay, and smaller bodies. But you can go online and learn the rules of 9. And then that way you can actually be able to see quickly how much of their body's burnt and whether it's lethal or not. Okay. Anything my nurse friend would like to add on that? No? Okay. So with the burns, I again am a huge fan of this right here. And this comes in bigger sizes. It's here's one right here. I have different ones in my kit, but if I needed to put this on quickly, very quickly to cool things off very fast and start the healing process, and then put some loose gauze around or whatever else I need to if I can't get to help. This is a great thing to have. This is the armor gel. Armor gel. Yeah, we sell it in a store here, and you can get it. It's probably some of the best stuff I know in the market right now. Oh, let's get the microphone.
Saran wrap is great.
Oh, totally.
Too.
Yeah.
Comes
Yeah.
off easy and doesn't stick to.
Exactly. And you could put the armor gel and the saran wrap right over it if you need to.
Yeah.
And so that's a good way to go. Thank you. Okay, let's go to the next section. Okay, we got lip balm, lotion, a few other things that you guys can do here. Let's go to hypothermia and hyperthermia. Okay, so hypothermia and hyperthermia. Do you guys know what the differences are in this? You guys can teach me. This one's pretty easy. Okay, hypo means cold, right? Hyper is hot, right? So what happens is this. Hypothermia is when you get so cold that your body stops shivering and then it starts shutting down. It cannot create its own heat anymore. Therefore, it needs an external heat source to be able to heat it up. And I have a really funny story about this that I told earlier in one of my videos. And this is when my brother and I were doing summer school and we were doing a health class back in, I think we were in junior high school, 7th or 8th grade, something like that. And we wanted to get some extra credit during the summer. So we went to, I think it was Mr. Edwards, something like that. I can't remember the teacher's names, but I remember his face because my brother and I had to do a report in front of everybody and we had to pick a health subject. So we picked hypothermia. Okay, and we learned a lot about hypothermia because you can actually get hypothermia not on a freezing day. If you're not eating enough and it's a little bit of a wind and everything like that, your body can get to a point where if it doesn't have the energy to fuel it and it's cold enough and you're weak enough, it can get to a point where you're not thinking straight. And when everybody else is saying, okay, let's take a break and eat, you're like, no, I got to keep going, got to keep going. You're like, wow, he's weird, you know, probably because he's not thinking straight at that point, right? And you get to a point where you can't shiver anymore. Your body doesn't shiver, can't create its own heat, starts slurring your speech, okay? And your heart starts slowing down, you get colder and everything else, and you can fall asleep, you could die. Now, if you find somebody who goes through hypothermia and they are completely unconscious and there's no pulse, doesn't mean they're dead. Okay? They're not dead until they're warm and dead. Okay? You can see, wow, they're completely, they're gone, blue and everything like that. Thaw them out. Okay? And if they're dead after that, they're dead. But there's people who everybody thought they're dead. And they take them, warm them up, they're alive. So they're not dead until they're warm and dead. Got it? So with the hypothermia, my brother and I were going, okay, let's teach everybody how to do it. And we talked about, well, if you're hiking and everything like that, we got our thing on. And all of a sudden you get into a hypothermia situation and somebody's dying and everything. Sometimes you just got to get in a sleeping bag together and take off your clothes. And so my brother and I, we got into the sleeping bag together, okay? And the kids, everybody in there is like just watching. They're like, what are they going to do? What are they going to do? And they all wanted to laugh. I saw it. Everybody's face wanted to laugh. But the teacher was right there and he was like, you're ruining my class, like that. And all of them looked at him and then wouldn't laugh. And I was like, this is horrible. It's totally ruined because when my brother and I got inside the sleeping bag, we had all these clothes in there and we started just throwing them out. And there's underwear and there's all this stuff we're throwing out. And we just thought it was the funniest thing in the world. I mean, like we got entertained by it, but that teacher does not like it at all. I mean, I just still remember his face. Like, you ruined my class. And so if I were a teacher, I would have laughed. I would have actually, I probably joined in. I don't know what I would have done. But hyperthermia is the opposite. So what's happening is you're out there, it's getting hot, you're sweating a bunch, you start going through heat rashes, you start going through heat cramps, you start getting, heat exhaustion, you get a headache, can't think straight, your heart's going, it's the opposite. So you look at these two right here, and hypothermia, cold, and stop shivering. Sometimes you feel warm, can't think straight, slow breathing, and pulse slurring. Get out of the cold and warm up slowly, okay? That's what you need to do. If you warm too fast, sometimes it's dangerous. Like if you have frozen limbs, right? Or something like that. You can actually hurt yourself if you don't do it right, okay? Some people say put them in a warm bath, let them heat up a little bit. Yeah, I've heard good and bad on that. And so you want to heat them up slowly, okay? Put some warm stuff underneath. Like for example, I've got this right here, okay? It's a great idea. Put some warm water in it, okay? Get them warmed up. Get them, if they are able to talk to you or anything like that, get some warm drinks inside them, okay? Start getting them warmed up from the inside out as well. Make sense? Okay. You have some good experience on that. Do you want to say anything else on hypothermia? Nope. Okay. Awesome. And then hyperthermia, heat rash, cramps, exhaustion, confused, nausea, dizzy, headaches. You get to a point where you're no longer sweating. That's dangerous. Your body cannot cool itself anymore. It starts shutting down. You get to about 103 degrees or higher temperature, okay? And you get to heat stroke where you go into a coma. You could die pretty quickly. In that case, you want to get out of heat, get out of their clothes, whatever you need to do, and cool them down quicker, not slowly. Does that make sense? Okay, so it's kind of the opposite. You don't want to just throw some cool water on them. You don't have to do cold water and put them in shock or anything like that. But get cool water in them. Get the circulation with cool going and anything else. Anything you want to add?
Be careful with the age of the hyperthermia because
Okay.
we were talking about kids and febrile seizures.
Yes.
Totally different ball game. I've seen people try to chill them from the outside in and try to do it quickly. Tepid water, room temp water, and if you're
So
gonna,
that is better than
that is way better because you're basically they're going to go up to their temperature at a certain quickness.
yeah.
You got to bring them down at that certain quickness. You can't go faster because that doesn't help the seizure.
And that's in this case of a seizure, right?
Correct.
Okay, awesome. That's really good to
Febrile
know.
seizure.
Okay, let's go right here.
Yeah, I had a little sister, about 2-3 years old, and she had a seizure, and we happened to be at a store, and a pharmacist took her outside and put snow on her, which created a
Wow.
worse situation. She went into shock.
Wow.
So you have to be extremely
Real careful with the
Yeah.
seizures. That's so good to know. Thank you so much. Any other comments on that while we're here? Okay, awesome. Yeah. Right now? Absolutely. Where did I put it? There it is. Let me throw this to you. Are you doing okay? Okay. Check real quick, but if we need to, we'll help you out right now. Okay. Just let us know. Little button in the front. Okay. Perfect. Good deal. Yeah. Thanks for even stopping the class. So you're more important than the class. Okay. So let's go a little bit more on this right here. We're talking about hypothermia, hyperthermia. One of the things that is interesting is people try to warm people up, but in all reality, if you're wearing the right clothes, Okay, this is foam clothing. This is stuff that I've tested out in sub-freezing weather without a tent, without anything else. In fact, of the video I played earlier in the course, I showed my kids sleeping out there without beanies on, barefoot and everything else in freezing weather, and they were warm all night. And I slept without anything with foam clothing on. This allows complete breathability. Okay, you can literally get this wet, put it on, and 45 seconds later you're warm. So it's a lot better than a lot of the stuff they're using out there, like the emergency blankets that are all, they call it Mylar, but it's a metallized blanket, right? And they get people in there, and all of a sudden it doesn't work as well as some of this other stuff. So if you have the right gear and you can get some external heat to them, it actually can heat them up a lot faster. Okay, let's get the microphone over here.
Don't you think though for a emergency pack that the Mylar blankets are good as far as being economical, an economical way to
Definitely. Size-wise,
Yeah.
if you're going to help somebody, but if you're going to prevent, this is
Prevent.
better. Does that
Okay.
make sense?
Yeah.
Yeah. So if you have to carry something, I've got one of those in there, okay, to be able to use it very quickly. I'm not going to be able to stuff this in my trauma kit.
Right.
Okay, but this is really good for prevention. So I tell people, and also a lot of times, with when we're doing the search and rescue stuff I've done, okay, with the search and rescue sheriff's department, they'll bring out these big old gigantic bags and stick people in it and try to get them warm and everything else like that. In all reality, I wish I had one of these to do that. The exact same thing, but they don't have it. There's nobody out there. Go ahead.
It also depends on where you're at. So, for example, I've got some of that equipment, and my thought is I'm going to bring it to any winter camp out I go on, any winter situation. And if anyone's in trouble, I can immediately put that on them and help them out a lot, especially on their extremities, like if you get the gloves or the things you
Yeah.
put on your feet or your head
Absolutely.
thing.
It works better than Gore-Tex. It works better than anything else that I know. And if you're able to get this on them, get some external heat going in there as well, if they're that far gone. I mean, hopefully they don't get to that point, right? Hopefully if they're that cold, you can actually get it before they stop shivering. But this is good stuff, good prevention right here.
What's the name?
It's foam clothing. I mean, we have, I don't know if Kyle, you can go over there. It's a little bit covered with that, what's it called? I'll just walk over here. But all this right here is made out of foam. Okay. And if you understand thermodynamics, in fact, I'll probably talk about it in one of the videos coming up. How's that? I'll just go more into depth to explain probably the law of thermodynamics so you guys understand how it works, because it's really cool. It's all science. It's like simple science. Okay. So let's keep going here. This is broken bones, sprains, and strains. Now, any of you who end up getting any type of sprain, strain, or anything like that, and you go to the doctor and you get yourself some crutches or you get yourself some braces, don't throw them away. Keep them for emergencies. Okay. I've got a bunch of these. Okay. And I just keep collecting them. I get hurt and I'm like, oh, there's another one I get to keep. Okay. And it's pretty cool. But make sure you have these and just put them away for emergencies anytime you might need them. And so I've got a bunch of them back here. Another thing that's good, let me grab this. SAM splints are really good to have. These are awesome because you can actually create a splint out of it. So if you need to, okay, you can actually put somebody's arm in here and put a wrapping around it and you got yourself a splint. Okay, it's called a SAM splint. We have these as well. Okay, but these are awesome because they can be molded to do what you need to do. You can cut them, make them smaller. You can create little finger splints if you need to. There's a lot of things you can do with these SAM splints. This is a really cool thing. I recommend everybody have this for emergencies. Okay, most people don't know what this is. It's a tuning fork. That's exactly it. But it's a bone tuning fork. It's tuned in for the bones where you hit it and you can hear the and you can go up to somebody's bone and you can go like this and it doesn't hurt. Then you go like this and it doesn't hurt. And you go here and you're like, oh, there it is. And you can find a broken bone with this just by hitting the different bones. It'll shake it and then all of a sudden you find the broken bone. Really awesome to have for emergencies. Finger splints, obviously, there's these. Exactly, ready for the boom, you know?
you got a whole bunch of different things: bandages, elastic bandages, compression socks. You can do a whole bunch of different things to help people out when it comes to broken bones, strains and sprains. Sprains and strains. How's that? Let's see if I want to cover anything else here. SAM splints, triangle bandages are good to have, but if you have a good, I've got a good triangle bandage right there, in a sense. Okay, cold packs, heat packs, all the types of different bandages that you can use for any of that stuff. So, anything you guys want to add to that? Any of you professionals that work with this as well? Awesome. Okay.
I have a question.
Let's go for microphone and then a quick question.
That clear breathable bandage.
Yeah.
I don't know about this, so it's a question. I hear that the clear stuff that they put on tattoos, I don't get tattoos, so I don't know about it.
Yeah.
It's breathable and it stays on and it's waterproof and it's great for wounds.
I've never had a tattoo, but I'm guessing it's Tegaderm. So I think it's the same thing. So let's go back here.
In a pinch, you can also use anything that you have around the house for splints and stuff like that. I was on an aircraft incident, and I didn't have anything but their logbook. So I took apart their logbook and curled around the cardboard.
That's really cool.
And then used bandages around that.
Oh, I love it. Yeah, and that's true. I mean, you can take cardboard if you need to. You can get a stick if you need to. You can break off, a broomstick. There's so many different ways. You just got to be creative. And you're right. Sometimes you're out in the wilderness and you don't have anything else except for what's right around you, and you got to be a little bit creative to be able to take care of some type of broken bone or whatever you need to do to get them to safety and get them helped right at that point. Cool. Okay. Awesome.
Cool wrap.
Say again.
Did you want to mention cool wrap?
Oh, cool wrap. Yeah, that's a good one too. Cool wrap. Let me see if I have it out here. I don't know if I brought it out. Boy, I should have a cool wrap out here. And I don't think I did. Yeah, I do. So a cool wrap also is really good because this right here, you put it on and it actually keeps you cool for hours. Okay, where other ones start heating up quicker. This is really awesome just to keep, bring the swelling down a tiny bit. So obviously you can use different types of pills as well to help with the swelling. Okay. All right, let's go to the next one. Infections, fevers, and sicknesses. I recommend everybody have a thermometer. You can have a digital one. You can get a traditional one. I like to have both. Okay, it's just smart. Okay, and you can use it under the tongue. You can use it in other places I won't mention. Just whatever you need to do to find out what the temperature is to see where they're at is a good idea. So some type of thermometer. Were you going to say something? No. Okay. And with that in mind, one thing I like to do is I get a ton of medications. Okay, I just brought a little tiny bit to show you guys. But this right here, those are all antibiotics, pretty much, okay? I've got a few extra things here, like ivermectin and a few other things I have, just in case I want to use them. But I also have an antibiotic guide. So if I need to know what to do and how to use it, I can get to it very, very quickly. In fact, on the next screen, I'll just show you a little bit of what's inside your book, your Thriveless book, so you can see some of the information in there. But I always have a guide to help me with what I need to use, the dosage, what it's used for, whatever else. And I got plenty of antibiotics for my family and myself. Ancient Chinese secret. How do you obtain it? In all reality, you can purchase it. We have some connections. You can reach out to us and talk to one of our workers, and we'll get you connected with some doctors who can prescribe it to you. And I like to go to Mexico sometimes, and I grab a bunch of stuff, and why not, right? And so there's different ways of getting it. Just make sure you go to a credible place if you're going to do that in Mexico, because there's some pretty shady places as well. So make sure you know the credible place ahead of time. Oh, go ahead.
Check with your doctor. I told him that I was concerned about things not being available when needed, and he wrote prescriptions for me to Mark Cuban's Cost Plus, which was much more affordable than Jace Case, which
cool.
I also tried, and
Yeah.
it's great. Jace Case can do it, but they
Yeah.
are pricey.
Yep. And so that's a really good way. If you can get it, any way you can get it, get it.
There's also so many natural remedies, and they really do work. Apple
Yeah.
cider vinegar, I would have that on hand for a lot of different things.
So tell me a little bit more about that. That's pretty awesome.
It's great for your gut, and
Yeah.
it's good. I just had my regular doctor tell me to put it on warts,
Yeah.
and it works.
That's really
So,
cool.
Yeah, apple cider vinegar.
So I'll tell you something. If you have heartburn and
Yeah.
everything else, I'll give you a little bit of advice. With heartburn, a lot of people will do an antacid. Is that how you say it? Okay. Your body. The reason why you're having heartburn a lot of times because the sphincter isn't closing. You don't have enough acid. So what I do is when I'm having that and it's really hurting really bad and I feel like, oh man, it feels like a heart attack, but it isn't, right? Okay. I just take apple cider vinegar and it's gone.
Yeah, I just read something about that where people over 70, usually it's that they don't have enough acid. It's not that they have too much.
Yeah, and that's what it is. You want to add acid. You don't want to take away acid. A lot of people don't understand that. What you're doing is putting on a Band-Aid you're doing a Band-Aid, you're not doing a cure. When you're doing the antacid, whatever it's called, right? The baking soda and everything else.
Sometimes in an emergency, though, a Band-Aid's about all you got.
Yeah, you just do what you can, right?
Yeah.
Yeah. Let's go right back here.
This may be a weird question, but can you use a meat thermometer, like one of those like laser infrared meat thermometers on the forehead?
I've never tried. I don't know.
Okay, all right.
Have you tried it for real? No kidding.
Absolutely. But
No
take a
kidding.
look at the specifications because sometimes your variance in plus and minus degrees
Yeah.
is how accurate you're going to be. But
Yeah.
it does work.
Wow, that's a new one for me. I didn't know that. And that's really cool to know. That is really awesome. Yeah, that is really interesting. Cool. Thanks for bringing that up. Any other thoughts before we leave this slide right here? Okay, I'll show one more slide right here. This is just an extra slide I put together. This is in your workbook. So you can actually go to the workbook, the Thrivalist workbook, and it actually gives some information. Now, this isn't everything. These are just ideas. We're giving you ideas. You can add to this. You take away from it. You don't have to do everything here. You do what you need to be able to help you and your family, right? Your work, whoever you're preparing for, right? Okay. And so the next one is other items to consider. One of the things I like to do that are in my kit is I put an extra pair of glasses because I can't see close. And if I don't have my glasses on me, okay, I like to have them right there as part of my PPE actually. I probably have, yep, right here, right there, okay? And I like to have just extra pair of glasses. You can put healing oils if you're religious. You can do saline for eye contacts. You can do eye contacts. You can do whatever you need to, extra hearing aids. Okay, there's a lot of things you can do as other items, children's medications, pet medications, whatever you want to. So just remember who you're preparing for and all the stuff that we might have not talked about here. You can add it to your list for your preparedness, for your medical and first aid preparedness. Okay, now, I'm going to go through a big list of ideas of training skills. Remember I told you the guy that told me, hey, just become an EMT. And I was like, wow, okay, let me do it. And it was hard. I mean, there's a lot of work, you know. You get that, you take that test and you pass it and you're like, I can't believe I passed it. And then you never want to take it again. So you keep all your certifications up because you never want to do it again, right? And so, but it's just really good information. So let's go through some of these. You should get CPR, AED trained, period. Everybody should know how to do an AED. Okay. Next, you should do some type of basic life support first aid training, which goes a little bit deeper. Okay, just a tiny bit. You have first aid books and manuals you should have at home. Okay, and these manuals can be a whole bunch of different things from specifics, like we were talking about herbs and everything else. You can have all types of manuals if you want to. You have advanced first aid training. You have advanced first aid books and manuals. You have stop the bleed training. Okay, where you learn how to stuff a wound if you have to be able to stop an arterial bleed. You have emergency medical response, EMR training. You have EMT training, emergency medical technician, which is what I am, okay? Then you have wilderness first responder, WFR training. You have advanced emergency medical technician training. That's advanced as AEMT, okay? And then you have natural medicine training, herbs, oils, tinctures. You have natural medicine books. You have other home remedy books.
You have paramedic training, where we have a medic right here. Nurse training, which we have a nurse right there. Okay, we have physical therapy training, massage therapy training, other medical training, understanding of physiology. Why not? Learn what does what in the body, what is the body, right? And anatomy as well. It just goes on and on. But there's so many things you can learn. Pick something. Pick something up here and just start learning it. Okay? And that's exactly what I'm going to challenge you to do. I'm going to have you actually do what you need to do to take yourself one step further. Let's go one comment, and then we'll go ahead and wrap it up.
How do you feel about CERT training?
CERT's great. CERT's great. Why not? Yeah, any type of training you can get, you know, the community emergency response training, okay? CERT. So why not? They're going to teach you a bunch of stuff as well, and you're going to get yourself a cool little kit and a hat and everything else, right? You're going to know how to triage. Why not? Okay. Awesome. So just to wrap this up, I'm going to encourage you before you get to the next video to take some time and make check marks on in your book, on the sheets you can print out, whatever you need to figure out what type of first aid supplies you want, what type of training you want to get, what type of educational resources you should be saving up and putting at your house, so that if you need to, and you need some type of survival medicine book, or you need some type of herbal book, or whatever you want to do, if you want to learn how to make tinctures, whatever you want to do, figure it out, and then go find the best you can find, so that you have it ahead of time in written form, in physical form, not internet or whatever, for you to help your family out. So that's my challenge. So let's go ahead and end this section right now. Do that before you get to the next section. Do something before you get to the next section, and I'll see you on the next video. Okay, we got through that. Let's see. Let me grab, this is a mess up here now. Okay. I don't even know where my clicker is now. There it is. Okay. Awesome. Go ahead.
One,
Is it something we should say in the video or no?
I don't know, tell me.
Okay, go ahead.
One, I always put a kit of medications together. We travel a lot.
Yeah.
I've saved a lot of our trips because I have it with me.
I love that.
And the other one is that some of these classes that teach the CPR,
Yeah.
they're now also teaching IV starts. So
I didn't know that.
yeah, so you can go take
Wow.
a class. Yeah, because if you're a first responder,
Yeah.
you're not a doctor or a nurse or whatever.
Yeah.
You may have to start, you
An
know,
IV.
you
Yeah.
carry an IV in your.
That's really cool. I love it. Good deal. Well, that's perfect. Thank you for bringing that up. Awesome. Well, let's get to the next one. I might bring that up just to get started. So, good deal. So this one's going to be pretty quick. Unless, does anybody need a bathroom break, or are we good to go? Okay. How are you feeling? Stable? Okay. Where's it at? Okay. Awesome. Is it? You were at 190? Oh my goodness, don't tell me that. And where was it when you first measured it? It was at 120. Okay. Okay, and you're doing all right. And you took how long? Okay, and when did you take it? Okay, awesome. Perfect. And so let us know if you need anything else. Okay. Okay, everybody else okay? Okay. Right, you're like, say again? You can have some of what she has. Yeah, there you are. Yeah, no kidding. Awesome. I'm glad you're doing okay. So, and I'm glad you told me or said something. Okay. Awesome. We are starting the next video. This is exciting. We're actually cruising along and learning so many fun things. And we're going to be talking about health. Let me try that again. Awesome. We are cruising along and we're on the next video. We're going to be talking about health maintenance, because obviously during an emergency, okay, you need to keep your health up because there's a lot of stress, right? And if you get sick during an emergency, it could be just downhill from there. You might never get better. So I'm going to ask you, before I even get into the presentation, what type of things would you guys like to do to be able to maintain your health during a long-term crisis? Let's imagine the worst of the worst. Imagine no electricity out there, okay, except for solar power or whatever you have at home, okay? No transportation, nothing like that. Can't go to the gym. You got to do it from home, right? Whatever you're going to be doing, what type of things would you want on your list of things to make sure you're taking care of to keep your health up, what type of things would you want? Let's get a few people to raise your hands and let's talk. Go ahead.
An exercise bike.
Awesome. So amazing. Okay.
Do a lot with it.
Yeah. Especially can't get out, right? Middle of winter, whatever, right? Okay, what else? What else would you guys want to have? Want or do? Want to have or do? Okay, right up here.
Be able to go walking.
Okay, walking. So having some good shoes, right? So, and the interesting thing is I've actually got my walking shoes, my running shoes, my jogging shoes, and I've bought extra shoes for emergencies. I just leave them packed away. Okay, that way I have them. You know, I'll get my couple thousand miles in, right? Okay, let's go a couple more people, maybe 2 more people. What else would you want to do to keep your health up in any way? Let's go right up here.
Healthy foods and supplements for when you're short on some healthy nutrition.
Absolutely. Yep, that's a really good thing to do. And let's go one more up here.
I think it's important to have something on hand for emotional mental health.
Totally. Thank you. You guys are hitting the points that I brought up. Yeah, you're right on. That's awesome. Oh, we got another one up here.
Well, in regards to that last comment, books,
Yeah.
things to entertain you,
Absolutely. Yeah.
games.
There's a whole section, a whole video I'm going to be doing on entertainment education later in this part of the course, the Thrivalist step number 5, because that's huge. A lot of people don't even put that in their emergency plans, but you're exactly right. And I liked your comment earlier where you were talking about having a little medicine kit that you take with you on trips, right? In between the 2 videos, we were talking a little bit. And I do the same thing with my daughter because she might not be able to breathe. And so I've got allergy medications and stuff like that for them as well.
I was always on the emergency preparedness at the hospital as the committee, and we had everybody in their lockers had to have, something that was a comfort to them, a little kit. And so a lot of people put chocolate in it,
Yeah.
square chocolate.
That's healthy, isn't it?
Well, it is.
There you are.
It is for your
Mentally, right?
emotions.
Yeah.
Yeah.
That and Twinkies. Twinkies too.
Twinkies too.
I'm just kidding. No Twinkies. Dark chocolate. How's that? Dark chocolate. Okay. But no. But there is an emotional end to this with the foods that you eat, and that's true. Okay. So let's go ahead and talk a little bit about the different things you can do to make sure you're taking care of your health. First of all, is sound sleep. A lot of people don't understand how important sound sleep is. Have you ever gone 2 or 3 days without sleeping well, and have you gotten sick because of it? Yeah. I have so many times. Pushing myself too much. And it is, as soon as you get sick, you know it's just going downhill because it's going to be some type of sinus infection or something for the next 2 weeks. Okay? So make sure you're getting plenty of good sound sleep. And some of the suggestions I would give you is to make sure you have a safe location so you're not worried while you're sleeping. You're not waking up every 2 seconds to see who's walking by you. Okay? A comfortable bed, warm bedding in cold winters, cool airflow in hot summers, and also a quiet private location so that you can get plenty of sleep. So those are the things I would recommend. Okay? Anything you guys would add on sleep? Any Navy SEAL trainers here or anything like that where you make them not sleep for 15 days in a row or something like that, right? And then see how crazy they can get. Okay? It's huge. So when it comes to sleeping, I have extremely good, expensive sleeping bags. Really good sleeping bags. Okay? I have plenty of good blankets and clothing and everything else to make sure that I'm completely warm, and so is my family during winter. And same thing with summer, being able to get some good airflow and everything else. Okay? Next thing is proper nutrition. That goes without saying. We've talked about that a little bit. Okay? The best way to get proper nutrition is to get adequate macro and micronutrients through food itself. But supplements can become crucial to maintain health during long-term emergencies. Okay?
So let's talk about a whole bunch of them. We can go on for hours on different supplements. People can talk about different types of ways of getting the right nutrients, right? We can talk about a ton of different things. So what I did is I said, okay, let's just go to the basics. Let's go to the ABCs, right? Of nutrition, supplements, right? Let's go through some of the regular vitamins. Obviously, you're going to want your prebiotics. You're going to want your probiotics, right? You can do your extra things on the side like massage therapy and red light therapy and, you know, SAD lights and whatever else you want to do. Okay, but let's just go through some fun ones. Do I have a good reader here? Somebody who's better at reading than me because I stink at reading. Okay, who's got a good reading voice here? Anybody? Oh, you just volunteered yourself? No, you smiled. Yeah, you just did. Let's go between you two. How's that? Let's go and start here. Let's do vitamin A.
Vitamin A. Adequate vitamin A intake is important for maintaining healthy eyesight, immune function, and cell growth. Vitamin A is found in animal foods as retinol and plant foods as carotenoids, such as carrots, sweet potatoes, spinach, and liver.
So everything here we have except for liver in the store, where you can actually save up this stuff for emergencies. So you can get a lot of your vitamin A from our sweet potatoes, from our spinach. You get the idea, right? Okay, you can get it from Whole Foods, but it's also good to have some type of multivitamin at least, right? But if you want to get vitamin A in it, if you want to break them down, you can do that. But if you want to just get something that supplements in, you know, multivitamin, that's fine. But let's go through the next one. You want to keep reading or do you want to do it? Okay. That's awesome. Okay, let's go ahead and keep going. Ready? Let's do vitamin B. Now, B is interesting because I would recommend a B complex where it has a whole bunch of them. But if you want to, you can always break out some of them. Let me see if I have one here. You can always get a B12 on the side if you need to, right? And you have a B complex. But let's go through the Bs, okay?
Vitamin B1, or thiamine, essential for energy metabolism and nerve function. Thiamine is found in whole grains, pork, nuts, seeds, and legumes. Deficiency can lead to beriberi, a condition characterized by neurological symptoms and weakness. Vitamin B2, riboflavin. I'm going to try that again. How do people say that even? Riboflavin.
You got it.
Vitamin B2, riboflavin, for energy production, cell growth, and antioxidant activity. Riboflavin is found in dairy products, lean meats, eggs, nuts, and green leafy vegetables. Deficiency can cause sore throats, cracked lips, and skin inflammation.
By the way, all these are inside the book, the Thrivalist book. All this stuff is in there, okay? And in this course, you'll be able to get all that information anytime you need to. Let's keep going.
Vitamin B3, or niacin, essential for energy metabolism, DNA repair, and cell signaling. Niacin is found in meat, fish, poultry, nuts, seeds, and fortified cereals. It is involved in the synthesis of cholesterol and can help lower LDL cholesterol levels. Vitamin B5, pantothenic acid, required for energy metabolism, hormone synthesis, and wound healing. Pantothenic acid is found in a wide variety of foods, including meat, poultry, fish, whole grains, and legumes. Deficiency is rare, but can lead to symptoms such as fatigue and numbness. Vitamin B6, pyridoxine, necessary for metabolism, brain development, and immune function. Vitamin B6 is found in a variety of foods, including poultry, fish, bananas, potatoes, and fortified cereals. It's involved in over 100 enzyme reactions in the body and is important in the production of neurotransmitters and red blood cells. Vitamin B7, biotin.
You got that? Thanks, by the way, for doing this. Here, go ahead and do it again.
Vitamin B7, biotin, important for metabolism, skin health, and hair growth. Biotin is found in egg yolks, liver, nuts, seeds, and certain vegetables. It plays a role in the metabolism of fats, proteins, and carbohydrates, and is often included in hair and nail supplements. We can just eat the hair and nail supplements.
Yeah, no kidding. Yeah, just
kidding. Don't do that.
Don't.
Vitamin B9, folic acid. essential for DNA synthesis, cell division, and to prevent neural tube defects in fetal development during pregnancy. Folic acid is found in leafy greens, legumes, fortified cereals, and supplements. Vitamin B12,
Good luck on that one.
methylcobalamin,
You got it.
necessary for red blood cell and hemoglobin formation, neurological function, energy metabolism, DNA synthesis, and helps protect nerve fibers. Vitamin B12 is primarily found in animal products, including meat, fish, eggs, and dairy. It's important for vegetarians, vegans, and older adults to get an adequate intake through either fortified foods or supplements.
Awesome. So now we're going to go to the vitamin C. So we're doing the ABCs. We're going to go a little bit further, but let's go ahead and do vitamin C and go ahead and read again.
Vitamin C acts as an antioxidant, supports immune function, and aids in collagen production for healthy skin, bones, and blood vessels. Vitamin C is found in citrus fruits, strawberries, bell peppers, and leafy greens. Supplementation may be necessary during emergencies when stress levels are higher and there is a higher chance of illness.
Awesome. And a lot of these things, you know, we talked about storing up stuff, right? Storing up vitamins and everything else. A lot of these can be stored up past their expiration dates, including the antibiotics. A lot of times people say, oh, it's expired, and they throw it away. They did a military study on antibiotics, and 15, 16 years later, they're almost as good as new. And so don't throw them away, right? You can use this stuff for a long time. So you store this stuff up and use it when you need to. You know, some of them are going to diminish a little bit in potency, but for the most part, this stuff is going to stay good for a long, long time. Let's go ahead and pass it over to him.
From what I understand, these are great as supplements, but don't rely on supplements alone
Nope.
because they're only there to catalyze
Yeah.
and or work with what you're supposed to be taking inside your body anyway.
Absolutely.
Otherwise, it's just waste.
Whole foods are always the best. And if you notice, I put the foods up here for you guys to notice where you get it. And have you noticed that most of those foods are stuff you can buy from us that have, a lot of those have 30-year shelf lives. Okay? You just put them away. You'll thank yourself for getting that food because 30 years from now, 10 years from now, a year from now with all the inflation going on, right? You're going to sit there and go, man, I wish I bought like 500 times more, right? But that's exactly it. So you look at the foods and you go whole foods first, but it's not bad to have the supplements if you need it during an emergency as well. Let's go another comment right up here. If you can pass that.
You know, one thing I want to say about supplements, though, is sometimes people think, oh, if a little is good for me, a lot
take-
will be
exactly.
even better.
Yeah.
You can overdose on
Absolutely.
supplements, and so you need to be very careful.
Yeah.
And if you think you need to take higher doses, you need to consult your doctor because it can be dangerous.
Absolutely. Yep. That is a really, really good point. And everybody's body is different also. I mean, when we get to vitamin D, we could talk a little bit more about that because that could be dangerous, right? If you take too much of that as well. But let's go ahead and do, did we finish C? I can't remember. Yeah. We did? Okay, let's go ahead and do D3. I guess we're on D, right? Okay, so that's perfect because D is an oil, and oils don't get assimilated as very, very easily in the body. Usually the body has to take the oil and break it into what's called micelle, and then the micelle can go into the bloodstream and be used. Okay, so that means that probably the majority of that oil is going right into the toilet, not even ever getting into your bloodstream. Okay, unless it's broken down ahead of time in some type of nano technology, which I've played with, and actually I have a D nano D that I use that actually breaks it down for your body, so you can use it really quickly. So it's pretty cool. So let's go ahead and do D, and D is interesting because you get. I'll let you read it and then I'll talk about it. How's that?
Vitamin D3, essential for bone health, immune function, and overall well-being. Vitamin D is primarily obtained through sunlight exposure and can also be found in fortified foods and supplements. Many people have inadequate vitamin D levels, especially those with limited sun exposure or darker skin tones. Vitamin D vitamins are sometimes hard to assimilate, but vitamin K2 helps take care of that problem, especially when taken with magnesium and zinc.
Yep, it helps it be absorbed to the right places. So with this in mind, we just got the blood work done for my wife and I, and we did all the tests we could just to see where we are health-wise. She is a lighter skinned person, way lighter than me, okay? And her D levels were way high, okay? And she stays in the sun and everything when she can during the summer, right? Now my I'm in the sun all the time and I've got darker skin, okay, and I get pretty dark when I'm out there. My D levels were really low. I need to have more D than she does to be able to supplement if I need to. And D, if you study it, is it helps, it helps with getting over depression, a whole bunch of different things it helps with, right? But a lot of people don't understand that you can go right here in Utah and go out in the sun all winter long and get 0 vitamin D. Okay, the angle of the sun is it doesn't allow your body to actually get vitamin D during the winter. So about half the year you can't get it. Okay, so you're gonna have to find other ways to do it. That's where people have different lights they can put on themselves during winter. They can, take vitamin D supplements, which I recommend you take with K2 or some type of chelated, some type of good magnesium or something like that you take with it. Yeah, travel. Say again.
Travel.
Yeah, travel. But there you are. Go down to Brazil during the winter, right? You go to Grand Bahamas, right? Something like that. That's a really good idea. So you can do that. Let's go ahead and pass that right over here in the front.
They say that most people in the United States are deficit in vitamin D.
Absolutely. Yep.
Yeah. So, but my question is, now we have such a scare with skin cancer.
Yeah.
A lot of us wear, lotion to protect us from
Yeah.
that. So,
What do you do?
yeah, what do you do?
Yeah.
Yeah.
And that's where you get into the SAD lights. You get into, a whole bunch of different things you can do. You can take the supplements. I have a theory, and this is a theory, and maybe some of you guys know if it's real or not, but I don't like sunglasses. Because my theory, my thoughts are that sunglasses are blocking the light, which allows my body to create the melanin it needs to be able to handle things better. And I don't know if that's true or not, but and plus I like to see people's eyes. I like to see them, I like to connect with them. So I just don't like sunglasses very much. So I don't know if there's any truth to that or not.
Maybe somebody else has the answer to this, but I think that sunglasses are good because you're protecting your eyes from
Certain
the rays.
UV
There,
ray.
yeah, there's certain things like macular degeneration that is,
Yeah.
I think, created more easily if you don't wear sunglasses. I don't know.
Yeah, and I don't have an answer for this. This is a theory. So it's just I don't know, but my thoughts are I think the body is pretty smart, and if you're blocking the light from coming in, it probably doesn't know what to create. And so I don't know if that's true or not. It's just a theory. But any other thoughts? Go ahead.
The more fair-skinned we are, the more the eyes need the sunglasses.
Okay.
I can't stand to go out in the sun, but my husband, is fine. It's probably you
Yeah.
and your wife. She probably would benefit a lot more from the sunglasses.
Possibly, yeah. So it's just something I don't know yet. For those of you watching the video, you guys get to do some homework and you get to let me know what you learned, okay? Or I'll try to learn myself when I have time. But you just take care of yourself, figure out how to do it, and vitamin D is important, super important to have. Let's get to the next one, okay?
Vitamin E acts as an antioxidant, protecting cells from damage caused by free radicals. Vitamin E is found in nuts, seeds, vegetable oils, and leafy greens. While vitamin E deficiency is normally rare, supplements may help during stressful times. Vitamin K2, important for blood clotting, bone health, and cardiovascular health. Vitamin K2 is found in fermented foods, cheese, egg yolks, and certain meats. It helps regulate calcium metabolism and may reduce the risk of osteoporosis and arterial calcification. Some studies have suggested vitamin K2 may work synergistically with vitamin D to support bone and cardiovascular health. While vitamin D primarily regulates calcium absorption in the intestines, vitamin K2 helps direct calcium to the bones and teeth, where you might need it.
Okay, let's talk a little bit about, we got through the ABCs of vitamins. Let's talk a little bit about a few more things, and let's start with omega oils.
Omega-3 oils, EPA and DHA. These are vital for your health to fight body inflammation, lowering the risk of diseases like heart disease and arthritis. Eating fatty fish or taking supplements with omega-3 oils can boost brain function, memory, mood, eye health, heart health, and overall well-being. Nitric oxide, great for vasodilation, increased blood flow, heart health, exercise performance, immune response to infections, neurotransmission, learning, memory, etc., erectile function, and wound healing.
In fact, this is one of the things we sell in our store right here. This is one of the best ones I know of, to be able to help with nitric oxide and a bunch of other cool things inside of it. A lot of people who've had heart issues have taken this, and I've just heard so many good things about it. So we ended up putting it in our store because of all the little miracles we've heard from all these different people where their health is increased and done better and everything else. And so we recommend this. This is one of the things I recommend right here is nitric oxide with a lot of other good things in it. Here. Oh, good point. Yeah, you know something, I should have put that in there, and I don't have it. I remember studying that, and I cannot remember my studies in all reality. Beets. Thank you. Yes. Yeah, as soon as you said it, I was like, yeah, beets. He's right. Okay, because this has a ton of beets in it. But beets is really interesting how nature is. Okay, what does a beet look like? Looks like a heart. Okay, and it's good for your heart, right? And that goes with a lot of different fruits and vegetables are good for different things, and they actually look like the thing that you're that you're eating, or the body part looks like what you're eating. How's that? Okay, go ahead.
I just looked it up and it says beets, number 1, garlic, meat, dark chocolate, leafy greens, citrus fruits, pomegranate, nuts and seeds, watermelon, red wine.
Wow, thank you. That's awesome. Yeah, exactly. That sounds pretty good, huh?
I'll stick with the dark chocolate.
There you are, dark chocolate it is. Awesome. Thank you for looking that up, by the way. Okay, let's get to the next one.
Multi-mineral complex. For a variety of minerals such as zinc, manganese, calcium, phosphorus, magnesium, or magnesium glycinate, or I-threonate.
It's L3
L-threonate.
Yep. And those, by the way, are two of my favorite because of the absorption levels. A lot of magnesium doesn't really do you much good at all, but those two are some of my favorites, so I actually put those two in there. These, for example, I think I brought a couple. These, I take these before I go to bed, and I take them when I wake up in the morning. Okay? If anybody has cramps at night, where you're sleeping and you get a cramp, okay, start taking magnesium. Magnesium starts repairing cramps. Now, it doesn't work like that. You have to take it consistently, sometimes for 1, 2, 3 months. Okay? You have to take it for a while for your body to start building it up, but then it starts helping with the cramps quite a bit. Let's go ahead and hand that over to him.
I understand vitamin C also with cramps.
I don't know about that. It's probably true, but I don't know enough to say one way or the other. Go ahead. Oh, can you pass that?
The doctors told us also that you need to take it with potassium.
Mm-hmm.
They
For-
complement each other.
And we're
That's really good to know. So, yeah, and potassium, again, is good for the heart as well. So, awesome. Thank you for bringing that up. Okay, let's go ahead and keep going.
Where should I start?
Let's see. So, L3onate.
L-threonate. Selenium, copper, chromium, molybdenum, potassium, iron, boron, iodine, chromium, etc. These minerals help the body in a variety of ways, including immune function, taste, sensitivity, DNA and RNA synthesis, healthy insulin response, muscle usage, and more. If there are certain minerals you need more of, such as calcium or iron, you can get separate supplements for them.
Okay, and you guys all understand when you see multi-mineral complex, you know what that means, right? Just like I said, B complex, okay, it has a whole bunch of it. You take one pill, takes care of a bunch of stuff, okay? You could do a multivitamin, it's the same idea, okay?
Protein supplements. These help with muscle growth and repair and provide you with the ability to function properly during an emergency.
Absolutely. In fact, what's interesting is I haven't been able to eat for the last 2 days much because it's just been really, really busy from morning till night. I have protein bars in my car, and when I'm driving, I eat a protein bar. And it's just awesome to have some type of protein supplement when you need it, and it just gives me energy to keep going. It's just really cool. Now, it doesn't have to be a protein bar. It could be something totally different. You can chew on some type of meat or whatever you want, right? But it's just really good to have some type of supplements when you can. And what's awesome is I got to travel a couple hours to get here, and I go through some windy roads and some canyons. And if my car ever breaks down, it's just nice to have that whole little something there with my warm clothes, my sleeping bag, and everything else I might need if it breaks down in the middle of the highway in the middle of the night with snow all over the place because I slid off the road or whatever, right? And so it's just good to have some really good dense protein or whatever else you need just to keep going. So protein supplements are awesome. All right, let's talk a little bit about adequate hydration. A lot of people don't understand that you have to be drinking water, but water is not enough, okay? I've already talked about this a couple times. You guys can finish this for me, okay? Why isn't water enough? Okay, let's get the microphone around. Where's it? Okay.
You need the electrolytes.
Yeah, I mean, you can literally get drunk on water. Okay, you can ruin your body with water. Okay, because you're putting way too much water in, stripping out the good stuff, and you're not replacing it. Just like sweating does the same thing, right? Putting too much water in. Okay, so when you're peeing, okay, that's a technical term. Okay, when you're peeing and it's completely clear, you have too much water. It should be faint yellow. So that kind of tells you. If it's dark yellow, not good either.
Like lemonade.
Yeah, kind of like a faint lemonade, right? Okay. If it's black, that's really bad. Okay. Red, bad too. Okay. But white also not good. So if it's completely clear, just understand you're probably drinking too much water. And you got to put some good electrolytes in your body. Make sure that you're getting what you need to be able to stay hydrated, because the electrolytes allows you to hold on to that water. Does that make sense? So on a hot day, okay, you're trying to treat somebody as a medic, right? You're not just going to give them water. You're going to give them some type of electrolytes as well. Okay. Let's go to quality exercise. The cool thing about quality exercise is you really don't need a gym. I got a gym membership. A lot of times I struggle to go to the gym because I've got what I need to do all the exercise at home pretty easily. Like I can do high intensity interval training. Okay, I can walk on a treadmill for hours if I need to. There's a lot of things you can do at home. I brought a couple ideas here just so you can see them. This is something I love. I have a bench at home, but these weights right here, I've got these. I don't know if you've ever seen them. I'll grab the other one so I can look strong. Now, if I can't get up, I'm sorry, but but these right here are pretty awesome because they don't take up a bunch of space. So the cool thing about these is that you can actually change the weight to whatever you need to. Okay, you can make it heavier or lighter depending on how many weights you want. So I got half of them here. Okay, and you can make this twice as big, by the way. This is just, I'm not that strong, but they have extensions for these to make them gigantic if you needed to. And you got two strong guys right here. You probably would need the extensions. Okay, me, I'm not even worked up to that yet. So I'm working on it. You can do these balls right here where if you need to extend your ability to do sit-ups, and you can do a better sit-up with these. You can use these for yoga, for Pilates. You can do push-up bars. You got stair steppers. You got a little mini trampoline. Okay, people talk about moving the liquids around, right? Making sure that you're keeping yourself healthy by jumping up and down, right? You got a pull-up bar that can go inside. You got a pull-up bar that can go inside a doorway, and you can be doing pull-ups. Everything that you need, you could do at home in all reality. You got this little hard foam that you can be working out your IT band and anything that's tight. You need to work out your muscles there, just go get a couple tennis balls. There's a lot of things you can do. So if you figure out what type of health you want to keep, what type of exercise, walking, running, whatever you need to do, soccer, throwing a football, baseball, whatever. You get that ahead of time before an emergency. Just save it up. Maybe even start using it and get a little healthier at home. Learn how to use it. Okay, next is mental and emotional health. We talked a little bit about this at the very beginning, and I'm going to bring it up again. Okay, as a fireman, for example, right? We are told to basically debrief. We just see something really bad that happens. And it's cool because as firemen, we check on each other. Now, there's a temptation to be macho, to be cool. You know, you're like, I'm good, and everything like that. There's a big temptation because guys are show offs, period. But it's been really awesome to see how the fire stations are actually promoting the firemen to be more open, to not feel bad if you need to cry in front of another guy. Okay, that's hard. I don't like crying in front of another guy, but they're promoting it, right? Talk about things, get things out. You know, there's a saying somebody told me a long time ago, that which you conceal grows. That's a powerful saying. That which you conceal grows. And you'll see it, you know, like I got off the rig one time, and again, it was the one where the guy died with the two tourniquets, and I watched some of the other guys laughing right afterwards about what had happened, and I was like, they turned to me and said, hey, you know, Mr. Jobs, how you doing? I said, I'm sad. I'm super sad. I mean, we watched a guy die, and his son watching him die right there, you know? Like, it was just, I'm sad for the guy. I'm sad for his family. And the thing about it is, they open up to me different times. They were laughing at that point, but that's part of, you know, you do it enough times, you start getting, like I said, gallows humor and everything else. It's your way of dealing with things. But one of the things I decided early on is I said, I'm going to try to feel it every time. Because the day I decide not to feel it is the day I start losing it. Does that make sense? So I want to say I'm sad. And sometimes I don't even feel sad. But just by saying the words, I'm sad, I feel it. Does that make sense? Like I push it down, but then I start using the words and all of a sudden it comes up. So sometimes you can't let it conceal. Okay, you got to get it out. And all of us have some type of trauma, right? We just got to get out there. Again, that which you conceal grows. And that goes for addictions. That goes for a whole bunch of different things, right? That's what you conceal grows. You have your sins, your favorite sins. You don't tell anyone about it. Just gets stronger. And on the flip side, if you have spiritual things, right, that you conceal and keep sacred, that grows also. And it becomes more special to you because you don't give it out as candy to everyone, right? Doesn't matter what it is. That which you conceal grows. So make sure you're taking care of your mental and emotional health in long-term emergencies as well. So to wrap up this video before we get to the next video, I want you to decide and write down how you're going to get proper sleep, how you're going to get the right nutrition, hydration, exercise, and how you're going to take care of your mental and emotional health during long-term emergencies. So go ahead and do that right now with this video. Turn it off, finish it, write it down, and I'll see you on the next video. Okay, guys, we're done for tonight. Awesome. So
explain the activated charcoal, what you're using for.
So activated is I was going to bring this up. This was a thing that people used to push all the time. There's a lot of controversy on this.
Oh, is there?
It is. It is. They would take it if you had poison or whatever else. You would take it. Does that make sense? And so go ahead.
We would use that as like right before we arrived at the hospital, because once it goes in, it's coming back out.
Oh.
Yeah.
And it just doesn't take that long to percolate for that matter, but it's basically designed to encapsulate
The poisons or whatever.
and that type of stuff.
Yep.
But
Yeah.
usually just ingestion by mouth. The poisons via snake bites and that other stuff, and that's not.
You're not going to do anything. Yep. Yeah.
A little boy that drank Clorox.
What is it?
Drank Clorox.
Drink Clorox?
A little boy.
I got it down.
Oh, I thought you were telling me to drink Clorox. I'm like, no. So he drank Clorox and you gave him this and it helped him out.
Yeah.
Yeah.
Coming back up, it would have.
That's a good point. Yeah, it encapsulates it all. So I have it just in case, okay, because it's not bad to have it, right? It's just you got to know when to use it and how to use it. So go ahead. Epicap.
Epicac doesn't encapsulate.
Oh, Epicac.
It just forces it back out.
Okay.
Yeah, something.
Yeah, so it depends on how far into the process it is.
Yeah.
If they've digested it and it's into the system, neither one of them work.
Yeah.
But what's the alternative?
Yep.
You try it.
Yeah.
Epicac
Yeah.
is like that. It just injects it out.
Another thing I like, and I think I have it here. This is, we might have a guy come and speak, but clay, bentonite clay. You know, it's good for health reasons to detoxify yourself over time. Does that make sense? There's a lot of little things you could be doing. We could have brought up probably 50 other things
tonight, but I think we got some pretty good ones. This one's a good one too. So if you get yourself some poison ivy, right? It's an oil. That's what's creating the problem is oils. So I just get a really good degreaser, and I make sure I not only soap up as much as I can to get it off, scrape it with some type of towel or stuff, do it again, okay? But you're trying to get those oils off as quick as possible. Does that make sense?
That is a good scraper as well because actually
Yeah, grainy. Exactly. Yeah, it helps out. It's grainy.
As far as the electrolytes and cramping, I
You know, let's get you on the microphone because I want to get some of this stuff. Is microphone here? And Kyle, are you still filming? Good.
So I had that issue with the cramping and knew I needed electrolytes.
Yeah.
My orthopedic surgeons like complained to him, and he said, every night before you go to bed, drop a Noon. Have you heard of athletes use these electrolyte tablets? And they're NUUN.
No, I haven't heard of
Yeah,
Noon.
just drink a glass of water with a Noon in it. It has all the electrolytes. You just
Huh.
drink it before you go to bed.
Okay, so I want to show you something really quick because I'm
Oh,
a
cramp crushers too.
yeah.
You haven't ever heard of those?
Phenomenal.
Oh my
If you
gosh.
have
Cramp
cramp,
crushers.
You take it right then, and it
Gone
It's called a
immediately.
cramp crusher
Cramp
yeah, they're little
with a
jelly-
K.
with a
jelly
K.
filled-
Yeah.
Okay,
yeah,
that is
You
awesome.
can buy them online.
So I'll show you with us talking about electrolytes. I'm going to show you two of them right here. So these right here, these are some of my favorite. The Relight. This is ones we sell because it's one of the most quality ones I know. There's another one that you can put in your cheek because you can absorb a lot through your cheek, by the way. It doesn't have as many electrolytes in it, but this is one of the other ones we have. But this one I like a lot because it just has a ton of good electrolytes. The problem is you got to remember not to take too much because of magnesium in there. Hey, you remember milk and magnesium, right? You want to clear yourself pretty quickly. That's a good way to just take a bunch of this. But you want to take just a tiny bit, and this will give you everything you need just with a tiny bit. You don't need very much at all. Let's get the microphone right over here.
Just one other thing. Another
Yeah.
thing that we didn't talk about is putting a good fiber tablet or having
Yeah.
Metamucil in your kit too for like a long-term emergency. where-
Absolutely. And so let me bring up that really quick because one of the things I do have a lot at home is I do have psyllium husk. And psyllium husk is great for clearing out the body. And so with psyllium husk, you got to remember, as soon as you put that in water, it's thickening up. So I like to put a little bit of bentonite clay, okay? Little spoonful, a little tiny bit of bentonite clay with a big heaping spoonful of psyllium husk inside a shaker. And this is how quick you do it, right? You get the clay in there, shake it up really good, get the clay all done, and then you get the psyllium husk ready, okay? And you do this. You go like this, and you heaping a tablespoon, and you put it in the water, and then you grab the cap and try to put it on. And of course, every time you try to put it on, it doesn't go on. And you're like, oh no, and you got it quick. And then you finally get it on, and you start shaking it, but you didn't put it on all the way, so water's going everywhere, and you're like, oh man. And so finally, you just finally get it on, shake it, shake it, shake it, and as soon as you can, open it up and chug it as quick as you can. Make sure there's a lot of water, because if you wait just about 30 seconds, you're gonna throw up. Because it's like drinking sludge, okay? But as soon as you put that in your body, okay, and then you get another big thing of water and drink it and just let it start growing inside there, that stuff does wonders for clearing out the intestines. That does, with the clay and the bentonite clay and the psyllium husk, amazing for detoxing over time if you need to. Let's go ahead and go right here.
in a pinch, Pedialyte.
Pedialyte, totally. Yeah, absolutely. Okay, that helps out tremendously. That's a good thing to have on hand. Thanks for bringing that up. Let's go another one back here, if you can pass it back.
You know, another thing you really need to have is Imodium.
Okay, yeah,
Because, but you can't buy it like you used to.
yeah.
I had to ask the pharmacist, what's going on? It has something to do with giving you a better buzz when you take drugs or something?
Oh, you know something? They're clearing so many things out because of that. People are using it. They're finding creative ways of doing drugs that they're limiting so many different things today. It's, I don't drink alcohol at all, period. But I'll tell you, they banned Everclear in Utah. And I walked into the state liquor store and I said, I'll take all your Everclear. And they're like, whoa, this guy's serious. And I walked out with cases of Everclear. Okay.
Everclear is the most powerful alcoholic beverage you could probably buy out there. Now, why would I do that if I never drink?
You can use it for perfumes, for
You can use it for so many different things, right? But also tinctures.
Yeah.
Okay? You can take herbs and you can create tinctures, and because of the alcohol, okay, you get down to about 30% alcohol when you water it down, okay? Because of the alcohol, it doesn't allow any microbes to grow. So you can just leave it there literally for years, decades, whatever else. Where other people, where they do other tinctures, sometimes you're worried about bacterial growing, especially if you touch it to your tongue by accident and stick it back in. You just did a lot of good things to your tincture, okay? So I have a little bit of Everclear, a little bit. I mean, I'm glad I don't drink because that would be really tempting. I got a lot of Everclear, okay? But the thing about it is you got to think outside the box. What are you going to use it for? How are you going to use it and everything like that? If you do drink, you are an alcoholic, I suggest don't buy it, okay? It's just too tempting, right? So let's go ahead and,
What was the recipe? What was the recipe for your spray?
oh, for that. So that's hypochlorous acid. Hypochlorous acid, and I'm testing out a bunch of different companies right now to figure out which one is the best to recommend. So I'm spending a lot of money, by the way, on different companies. And so when I have that recommendation, it might be in a couple months, even after I finish this course, I'll put it underneath the videos to recommend which ones, but it's really difficult. Water, non-iodized salt, like real salt like we have here, okay, and white vinegar. That's it. And then you have electrochemical reaction. You put it in a little machine, press the button, and about 9 to 12 minutes later, you have an amazing solution. I have them at home, but it's basically, I can show you with my hand. It's like for a liter of this, it's about that much salt and about that much vinegar. This.
A pinch a piece.
Like barely anything, you guys. No, not even half a teaspoon. No, it's like tiny. It's like, I'm trying to remember what it is. It's nothing. It's like so small. And yeah, it's a smidgen. That's a good word. Okay. I don't know what that means, but smidgen. Okay. But the thing is, it's really tiny, and I've been trying different amounts at home to get the right amount. And I wrote it down at home. I just don't have it here. Okay. And it's pretty cool. It's like really fun stuff. So I'm going a little deeper in it, and I'll have more details as soon as I can. Oh, like whatever you want. I mean, you can do gallons. You can do 55-gallon tank, whatever. But I'm doing about a liter at a time. So 1,000 milliliters.
So I have a hypochlorous acid machine, and I use it for everything, including I've experimented it with laundry, but it hasn't worked so well.
Yeah.
I actually have like all my towels are soaking in a hypochlorous solution right now.
Yeah.
Because it will kill everything, plus it will deodorize.
Absolutely. So
awesome.
have you ever had those excuse me. Have you ever had a washcloth or a sponge that you're using in the sink, right? And it stinks so bad, and when you touch it, your hands stink. And then when you wash your hands and smell it, what happens? They still stink. You can't get rid of that, okay? It's that bad. You can take hypochlorous acid on that little towel or on that sponge, and instead of having to put it in the microwave and try to kill everything and then 2 days later it's smelling again, literally I go psh, 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 psh. Doesn't smell.
And yeah,
does,
it's 3 days if you're exposing it to light,
sun or heat,
and about 14 days if you keep it in a cool,
dark, cool place. Dark, cool place. Yep.
And the vinegar isn't strictly necessary, but it makes it more stable, as I understand.
It's not stable. What it is this. So you guys want a little science here, and I'll go into it later on again. Okay. So is this interesting, or am I boring people?
No.
Okay. Okay. So here goes. Ready? On the bleach side, bleach is a base. Chlorine is an acid. Am I doing it opposite? Hold on. Okay. Chlorine is an acid. Bleach is a base. Bleach was built to do bleaching things, to make things white. Okay? The reason bleach works to kill things is because of an ion called hypochlorite. Okay? Or you can use sodium hypochlorite or calcium hypochlorite. Hypochlorite has a negative charge.
Bacteria has a negative charge. Viruses have a negative charge. What happens when you put two negative charges together? Blink. Yeah. They don't like each other. Okay? So it's not the best way of killing things. The reason it works is because it is an oxidizer as well. And oxygen, as much as you think it's good, if you have it too much, it's actually bad for you. Have you heard of antioxidants? Okay? You don't want too much oxygen. Everyone thinks, let's just breathe as much oxygen as we can. It actually could hurt you if you get too much oxygen. Okay?
Oxygen versus oxidation.
Oxidation. Yeah, but the oxygen can cause the oxidation. Right. That's the thing. Okay? So with that in mind, you have an agent that can create oxidation, which can kill things. But at the same time, it's a weak one because it's a negative charge. And as you add water to it, it takes the pH from its 15 or whatever it is, down further, down, closer to an acid, closer to neutral, right, 7. And as it does that, it starts putting out a thing called hypochlorous acid. Okay? Now, hypochlorous acid, it only puts out maybe 1% or less of hypochlorous acid. That kills better than anything else. But hypochlorous acid lives right close to neutral. If you want to get as much hypochlorous acid as you can out of something, like the biggest potent amount of hypochlorous acid, it's right around 5.7 on the pH scale. Okay, on the, did I say that right? RH, pH scale. Thank you. Potential hydrogen. Okay, so on the pH scale, 5.7. When you have water that's 7, and you add a little bit of white vinegar, it takes it down. If you add the right amount of white vinegar, it takes it to 5.7. That's where you get the most amount of hypochlorous acid. Does that make sense?
Yeah, and then you can also, you need the compound for this, but you can also make, I think it's potassium chlorate or something like that. You can use the same, you don't use
machine?
salt,
Yeah.
but you can use the same machine.
Yeah.
And you feed it like some sort of base, and it will actually create a degreaser versus like a sanitizer.
So cool. Wow, that's amazing. Can you share that with me later on?
Yeah, I can.
Okay,
Yeah, I
okay.
can even take a picture of it and send it to you.
Okay.
Get the exact. I believe it's KCl.
Okay.
Is the compound that's created, and I don't remember what the base is, but it's some sort of potassium base
Boy,
that
I'd
you
love
put
that.
in it.
Yeah, if you
So-
wouldn't mind that.
Mhm.
So that's awesome. Cool. Thanks for sharing that. Good deal. Let's go microphone up here.
No, I was just saying back to the ratio of acid.
Yeah.
White vinegar. How much of the vinegar? I didn't hear that part.
What was the word again? Smudge it? Smudge?
Smidgen?
Smudge it?
Was
Smidgen?
a smidgen? That was for salt, wasn't it?
I don't know what that means, but smudging.
Oh, both.
It's just a tiny bit. Yeah, it's so little. Like it would amaze you how little it takes to be able to
There
create
is. I have little measuring them.
Yeah.
Smidgen,
Yeah, I have
dash.
I have it
all
at
that.
home. I just
Yeah,
don't have it
okay.
memorized. So because I have the measurement, I had my wife write it down. I'm like, okay, I got it. You know.
And
So-
you just whip it up and take it in the bottle?
Yeah, you just put it in the water, stir it for 2 seconds so it gets all over the place, and turn on the machine.
What machine? That's what I'm.
Yeah, it's a hypochlorous acid generator, is what it is.
Oh,
It's
so we need that. We can't just go home.
No, you can't just do it. You have to have, you have to have a hypochlorous generator. I've been buying a bunch of them to test them out to see which ones are the best. That's what I'm spending a lot of money on. Yeah.
Okay.
So I'm just buying a bunch and testing, seeing what it is. So yeah.
Have you ever looked into? So you can get. I mean, like there's like hydrogen peroxide, which is basically like, and then there's like, what's it called? I don't remember what the opposite is. Never mind. But hydrogen water. Have you ever looked into like
I have.
hydrogen water and?
Whether it's healthier, everybody talks about alkaline water and everything else. and
Yeah, that's the
hydrogen water and
opposite
everything
one.
else, right? Yeah. So from what I understand, your body, you dry again. There's a lot of controversy. People are going to get upset because I drink my hydrogen water, I drink my alkaline water and everything like that. From everything I'm learning, hydrogen water is actually probably pretty good for you. Okay. From what I understand, it creates an alkaline water, which might not be the best for you. Okay. And so that's what I've learned so far. I might be 100% wrong, but that's what I've learned so far. Because you got to understand, you're taking a if you take a high alkaline something or other into your body, okay, it's the hydrogen's helping, right? But the alkaline, you got to remember your body has to
create it. You create basically a balance. Okay, you got acid in your stomach. Okay, you got to create some type of balance. So there's a little bit of controversy on there. I'm still not sure in all reality because I've seen both sides, but I know that people are super passionate about it. No, it's true. It's and other people, no, it's false. And I'm like, forget it. You know what I mean? So I don't know all the answers, but that's what I've learned so far.
And one other question. Do you have like a herbalist in your network?
Yes.
And do you have like, I mean, you can get so much into the herbs, you can just turn your whole house and garden into herbs, but do you have like a couple that are like your favorite? Like I always have this, or I would always grow this.
Like herbs in my collection, you mean?
Yeah, huh?
Got
Herbs
it.
in your collection.
Okay, I actually have probably $1,000 worth of tinctures at home. Okay, a whole bunch of different tinctures to do anything and everything. If you want to get started with that, I would say study Dr. Christopher's because you're going to learn a ton from Dr. Christopher's. And then you can go from there, right? There's a ton of stuff there. This one right here, this is Nicole. She has her lost book of herbal remedies right here. The people who, she's amazing. She was on Alone, if you've heard of the show Alone. But the people who helped her with some of those recipes are my friends, okay? These are guys that live in Utah. There's one lady and one guy that live in Utah. These are some of the best, okay? And they're in Utah. So if you guys want to, maybe sometime I can invite them to give a class. But they're the best.
Also, Dr. Patrick Jones in Idaho, who is a veterinarian,
Yep.
has an online herbal school. So he's a naturopath and a medical veterinarian, and has videos all the time on
That's so
Facebook
cool.
that he's Patrick Jones.
Wow, Patrick Jones. That's awesome.
Yeah,
Thank you. Thanks for
he's-
sharing that.
Uh-huh.
Yeah, that's really cool. Awesome. Any other, this is really cool. Like we're learning a lot here. In fact, I should have asked you guys. In fact, I will ask you guys, and maybe I'll edit this in. But before we end tonight, let me ask you, are there, we went through a bunch of vitamins, minerals, and everything else. What are some of the favorite things you would add to your emergency preparedness supplies when it comes to nutrition, when it comes to anything to keep your health up? What type of things did I maybe miss that you would recommend? That isn't, it's not a sales pitch. I don't want a sales pitch. Okay, I just want you guys to give some quick little answers on what you would recommend. Let's start up here with the microphone.
We have a large population that's not prepared,
Mhm.
and they won't be adequately nourished. Their immune system won't be working well. Disease will be rampant. And you want to have mitigation of disease vectors such as fleas on animals you might hunt,
Mhm.
and mosquitoes.
Mhm.
So mosquito netting, I don't like
Yep.
the chemicals, so I'm not going to put the chemicals on me, so I'll use more mosquito netting,
Mhm.
head
And-
net, and as far as the pyrethrins, which would kill the fleas, if you do kill an elk or a deer, you could put a tarp over it, put some pyrethrin there, go away, come back later.
It's a good idea. I'm going to be talking a little bit about that, hygiene, sanitation, a whole bunch later on in the course. Any other thoughts of things that you say, wow, this would really be good? Let's go and pass that back there.
Well, I'd like to have turmeric.
Turmeric, yeah.
Yeah, it's really helped with my arthritis in my thumb. Whereas
Yeah.
I can take ibuprofen, doesn't do it.
Yeah, good point. I do have Benadryl. I do have ibuprofen. I do have, different things, different normal medications. I have that stuff, hydrocortisone, different things that I keep at home just in case I might need them. And it's just good to have a couple extra things. In fact, let's go right up here.
I just learned that you can do a turmeric bath, and it actually cleanses. It what was that? I haven't tried it. I bought it at a store in Peachtree City, Georgia,
Yeah,
and it was a herbologist.
yeah.
Yeah, and so I bought it and I have it, but I actually was afraid it would ruin the
Okay,
tub
yeah, you
too.
you
It
get a
would
whole bunch of
color.
color there, huh?
Yeah.
Yeah, and people do have Epsom salt baths as
Yeah.
well. Ice baths are really good. I mean, people are
I've
talking
done
about,
that, the Wim Hof.
yeah,
Yeah,
they're
our
talking
son
about
does that.
even just 12 minutes
Loves
a
it.
week. I mean, it can do miracles for
Yeah.
increasing your immune system, for taking down inflammation, for increasing why did I go blank? Not, uh, oh man, I'm going blank on the drug in the brain. Not serotonin, not cortisol, uh, not melatonin, dopamine. Thank you.
Yeah.
So it helps increase your dopamine, natural dopamine.
Yeah, he does that. His kids do it. I've
Ice
done
baths.
it. It's great.
Yeah, yeah. So
Yeah.
there's things like that.
Just
So
yeah, so you get a trough.
yeah,
Yeah, we have one,
yeah,
and fill it with water and ice and keep it out.
yeah. Even
And
even if you don't do that while you're taking showers, and I'll give this as a little bit of advice. While you're taking a shower, you can start warm if you need to, but just start turning it down. And get to a
exactly.
point where you're like, you get that part where you can't breathe, you know what I mean?
Yeah.
And you get to a point where you start getting used to it. Now, if you want to go one step further, if you get used to that water in the shower, you can be filling up a cold tub, like as cold as you can get it in the winter, right? And get a cold tub. And when you get done with that cold shower, you get inside the cold tub for a good 10, 12 minutes. And guess what happens? It gets warm and it doesn't feel that cold.
Yeah.
Like you're in there and you're like, this isn't that bad.
No, it's great.
You know, you start with the shower and hop in the tub and you're fine. You know, so
Yeah.
yeah, yeah,
No,
dude,
actually, it is great. Just
yeah,
yeah, yeah, it relaxes you and
yeah,
you feel great. You know,
yeah,
it's nice to get into a warm, comfy bed.
yeah, exactly.
Yeah.
So let's. Any other thoughts of things you would add that I didn't necessarily talk about? Let's see. Do you have one? Go ahead.
The K2 that they're talking about,
Mhm.
um, it comes from like sauerkraut or Japanese natto,
Good point.
and so you can have those naturally.
Yep.
And most people have too much calcium, and God gave us four things called parathyroids, and they regulate phosphorus and calcium in your body.
Cool.
And in order for it to work,
Yeah.
you need vitamin K2.
Yep.
You take K2, it causes the parathyroids to send out a hormone into the blood that pulls excess calcium and sends it to your bones and teeth, where it's used and stored in case you need it.
And that's what I was learning about the vitamin D, that if you don't have a mechanism to take it to the right places, the vitamin D isn't going to the right places, the
Right.
D3, right?
And it's going to go with the calcium,
Yeah.
but that way it pulls out the excess. Otherwise, it stays inside your veins and arteries and calcifies them, which is what always causes strokes and heart attack through history until they got COVID. And
Yeah.
that speeds it up.
Yeah.
But so if you take that, it pulls the excess calcium, and when the calcium drops, the phosphorus drops automatically.
Cool. Thank you for sharing that, by the way. That's awesome. Any other thoughts on health, on medicines, vitamins, and anything else? Go ahead. Let's go, both of you guys.
I know of someone who can't take a zinc supplement because it irritates the stomach, and that's even with food.
Yeah.
Any alternatives? She hates pumpkins. Period. Cleaning them as well as eating it. Right. I will try the pumpkin seeds. Okay.
Cool. Awesome. Thanks for sharing that. Let's go right over here.
All I can say is just have an open mind to natural therapies and tinctures and other things like that, because those supplies will run out very quickly. And if you don't have some other way to take care of that, that'll be game over.
Absolutely.
So have an open mind to it. A lot of people
Yeah.
don't. You'll suggest something and they'll just go, no, I'll just talk to my doctor.
Yeah.
Well, your doctor might be dead. So think about it.
Absolutely. And that's the thing, like my wife and I got into the practice of trying to figure out, can we do this naturally before we have to do it
unnaturally, I guess, synthetically. And sometimes you just got to do the regular doctor things. But we've been finding more and more solutions where we don't have to go to the regular medicine. Have you ever seen those? What are they called? We used to make them when we were kids. Know what I'm talking about? It's like it's got a string, and then it's got a bar, and then it's another string, and then bars. Is it called mobile? Mobile. Yeah. We used to make them when we were kids, right? Try to balance them all out. What happens with a lot of those drugs out there is you end up having a problem, okay? So you take a drug and it puts it back this way, but then it starts leaning this way, and then it's leaning too much this way, so you take another drug and it does this. And then what's happening is all those little ones right here are starting to go off balance as well, and you start taking more drugs to fix the problem with the other drugs. And so it just gets really bad over time, and then people are taking like 50 different things to correct the problems that were created from certain drugs, right? Now, that's not always the case. There's sometimes you absolutely need something. But there's way too many people just saying, oh, well, I'll just do a simple fix. And then what it is short-term gain with long-term pain, right? Instead of short-term pain with long-term gain if you do it right.
A lot of times, too, people don't read the instructions
Mm-hmm.
and they don't know the interactions. They don't know the time of day they should take them and the distance in time that they should take from certain drugs. And so when you're taking a lot of drugs, it's really hard because you could be doing more harm just because you're administering them wrong.
Yeah,
Yeah.
absolutely. And you get too dependent on them, right? Way too
Yeah.
dependent.
You
Let's
know,
go ahead.
if you eat right,
Mm-hmm.
more than likely you're going to be just fine. You
Yeah.
know, and you had a list of everything there that contained the vitamins and that. That's eating right, the whole foods.
Yep, absolutely. Whole foods is the best way to go. So you want to lose weight, eat the right foods, right? That's most of it right there. Then you can do your walking 10,000 steps plus a day. You can do your, HIE, it's a can you guys help me? High interval. Thank you. Okay, intermittent fasting. You can do a whole bunch of different things. And it's funny because I know the principles and I'm working too many hours, so the cortisol is building up a little tiny bit. But there's really easy ways to be able to take care of your health pretty quickly if you know what they are. Just do the right things, right? And do them. Like if I worked out for 5 hours straight, I could probably get the same workout if I just sprinted for 30 seconds 15 times. Okay. But the problem is what happens when you get to 35 years old, statistically, when you get to 35 years old, okay, and older, most people never sprint full out ever again in the rest of their lives. Isn't that interesting? 35 years old. Okay. So how do you get it? How do you get it so you keep doing it to 40 and to 45 and 50 and everything like that? When I learned that statistic, I actually went to the gym and sprinted as hard as I could because I was like, I'm going to be 55 and do it, and so it hurt. Yeah, exactly. Okay, so one more and then let's call it quits. Anybody else have anything else they want to say? Okay, you guys are awesome. Okay. Thank you guys. Thank you everybody online.